A little bit about me. Who am I? I'm Dr. Benjamin Sundapan. I did my MBBS from Manipal in India. So I'm specialized in occupational medicine. I'm membership faculty of occupational medicine from Royal College of Ireland. That's the specialization. And then I also, apart from all my memberships and fellowships, I also did the diploma in Ayurveda. So I have studied both the western and the eastern part of the medicine. But that's how I combine my knowledge to treat patients. That's how I discovered about these issues as well when I combine both the knowledges. Alright, that's why I want to share with you today. Okay, so if you look at my photograph, the picture is big, but I look small there, but I'm also big. But just to show that the knowledge I have is still that low. There's so much for us to learn. I'm just sharing with you the little bit knowledge that I have. There's so much for us to, and so many knowledgeable people more than me they are. All right, so I'm just sharing with you what I have learned and what I've experienced. All right, next. So again, this is a famous quote from Tamil. All right, whatever we have done is all praise God. By God's grace, we are here. By God's grace, I am here. And by God's grace, we are doing all these things. Okay, just thank God for all that. Okay, next. Okay, now I've told about me, a little bit about me, and then through MHSBSL, you all would have known by myself as well. So I just want to have an ice-breaking session because most of you all don't know each other. I want you all to introduce yourself, where you're from, what are you doing, or is there any specialty field that you are in your practice, or something, just a brief thing, alright? So we start with Dr. Mani.
Okay, I'm Dr. Mani. Manivangan Vanadi Pillai fully. I'm practicing in Bandar Bukit Tinggi clan for the past 23 years, 24 years there, actually. Basically, I was more trained on orthopedics. Okay, so I do most of the minor orthopedic procedures, including amputation, all I do there in my clinic. And I do extensive dressing, I was trained in, of course, vascular, tendon repairs, or sometimes I do that. And I was from breast cancer unit because I do screening, all I do there. So basically, all the things, basically minor surgery procedures, I do a lot in my clinic. And of course, I did occupational health.
Okay.
But for the past few years, I never registered.
So the 3 years lapsed already.
Yes, correct. And in those, I just left it because my side are not many patients or not.
Okay.
So I don't go and attend meetings or
Alright.
okay.
Thank you, Doctor.
I'm Dr. Suraj from Sigaman. So I have a GP practice there, took over from my father, late father. So it's 2027 will be 50 years old really. So I'm was trained in the radiology department, so I'm more towards ultrasound and stuff. But didn't pursue because my father not feeling well, so I had to come to over his son. So I'm very interested in all the ultrasounds and everything. So then Dr. Ben is the one introduced me about Steplex. So there were a lot of patients coming with all these back problems, knee problems and everything. So I would like to have some more knowledge about Steplex.
Thank you. Doctor.
Nurse Suliana, I'm a respiratory and sleep physician, currently practicing in Adelaide. So I did all my training in Australia and I stayed there. I'm here with my mom.
Okay. Alright, thank
So,
you.
yes.
Okay, I'm Dr. Azlini. I've been practicing, I'm a GP, practicing since 1991.
Alright.
Still practicing GP.
Which specialties that you do in your clinic?
Not actually, but I prefer to see babies and children.
Alright. Most on the beach side. Thank you.
Hi, good morning. I'm Chong. I'm a GP from Bukit Bintang. This is my son,
Alright.
Sing Yu. He's
Okay.
18 years old and he's come today to get fitted.
Okay, alright. that's our admin staff, Hidayah. So she
Hidayah,
handles-
finally we get to meet her.
So she handles all the MHSB admin. She's the main person that assisting us and doing the background work actually. Alright. So I'm asking her to sit on the session so that she has some more knowledge as well. Alright. Yes, Dr. Vanessa.
Hi, good morning. I'm Dr. Vanessa. I think I'm the youngest GP here. So actually, I'm doing a solo practice, taking over my boss lah. If you guys know Dr. Bamini.
Yes.
Yeah.
Okay.
So she's so taking over this one. Basically, before I quit, I did my training in Sarawak, mainly antenatal. So somehow I came to GP, still stick with mainly antenatals lah. Then last year I did my diploma in derm. So sometimes I see some derm cases also.
Alright. That's good. Thank you. So I think we have a smooth ice-breaking session. Alright. So Dr. Chong, are you doing anything specialty in your clinic? Any special
Check
things?
of all trades,
Everything, that's what it is.
GP.
The typical GPs. Alright. Okay. Thank you for all the introduction. Next slide, please. Okay. So we're going to have a few modules throughout this session today. The first one, we're going to identify learning the root causes of musculoskeletal disorders. Alright. Number two, we're going to go on a hands-on training on how to do the footprint and assess what are the issues with the footprint and how to analyze them. Alright. Third, they analyze the different types of footprints and how to advise patients as well. Alright. So the second one will be more on hands-on. Third one on how to analyze and advise patients as well. Alright. So from there I think we can complete the whole session for the step-lex training, and you'll be able to do it yourself. It's very simple. Alright. Do it yourself. Once you understand the concept, it's very easy. Alright. Thank you. Next. Okay. So the objective of module 1, okay, again, like what we said, we need to have more insights on how to correct the root causes. Alright. So in module 2, able to identify the limb length difference and then also to practice the footprint techniques. Alright. Module 3, how to interpret and analyze the footprint and advise the patients. So these are the 3 different modules that we're going to go through throughout the day today. Alright, up to 1 p.m. Next. So coming to our medical school back. So I think, what's your name again?
Ling.
Ling.
Ah.
Ling, okay.
Yes.
He might be a bit Uhaba. It's good to know for you to know also, and if in case you want to do medicine, this is your first class. Alright. So common musculoskeletal disorders, alright. You know, from anywhere there's muscle, there are issues. Simple as that. Alright. So from your foot up your neck, up your head, wherever there is muscles and bones and eggs, you have all the aches and pains. Okay, this is what a typical common musculoskeletal disorders are. Alright. So I'm not going to go into very much detail on what are the issues that you're going to have. Alright, because I think you all have known it. I don't think so we need to go in detail what are the processes. Okay, for mainly what we're going to concentrate today is backache, because that is the most common one. I mean, because we're going to discuss the whole issues in one day is not going to be enough. Alright, so we're only going to be concentrating on the lumbar, that means the backache, the sciatica issues. Explain on that, and then you see whether it makes sense or not. Understood?
Yes.
Alright? So anytime you don't understand, please stop me, I will explain to you. Alright? If I'm going too fast, please let me know. The speed is okay?
Yes.
Alright?
Yes.
Okay, thank you. Next. Okay. Come back to, as I said, we're going to concentrate on low back pain today. Alright? Of all the musculoskeletal issues that we have seen, let's concentrate on only low back pain and discuss on that today. Alright? So that we are more concentrated on explaining things. Okay? So if you agree with me, most common musculoskeletal disease that we see in the GP practice is backache. Correct?
Yes.
Lot of cases, most of them come back to backache. That's what are the main cases we see. Alright? So out to 10 to 40% of acute low back pain develop persistent and disabling symptoms. This is all statistics. This is not my statistics, it's the statistics and studies has been done. Alright? Acute low back pain, 18 to 15% have specific causes is identified. That means only 8 to 15% you have specified causes why the low back pain is. almost 85%, we don't even know where the pain is coming from. Alright, so that's how the issue of musculoskeletal issues are. Only 15% you know, that almost 85% we don't know where it's coming from. You're just giving them the painkiller and letting them go. Alright? So next, the slide that I said, the balance 85% is non-specific. Don't know where the pain is coming from, but you have no pain. Alright? So all these are statistics, not my statistics, all the studies have been done. Okay? Next. Again, epidemiology wise, there's no difference between male and female. They all are equally affected by low back pain. Alright? And then of course, the moment you reach 40, Vanessa will not have because she's the only one that will not have backache issues. I can't ask your age, you as well. So both of you will not have it now, but once you reach 40, you will have it. Okay? So that's again the statistics. Once you reach the age fourth decade, that's how it starts. Okay, remember that, yeah? I'll tell you why. Why it starts at 40. And then lifetime incidence got 10 to 40%, annual incidence 1 to 5% for everyone. And then rarely occurs age of 20 unless due to injury or some other issues. Alright? So 20s, I think when we are 20s, we were running there and here and there's no issues. Now you do one thing small and then there's aching everywhere. Right? Not me, for others. Okay? Okay, next. So again, the Lancet study, okay, done. Years lived with disability caused by low back pain increased by 54% from 2009 to 2015. So that's just a drastic and massive increase. So these are the studies in terms of this. Low back pain issues is not settling down. It's not even coming to a plateau. It is on the exponential graph. That means year by year, it is on the rise. That means there is no, what you call that, interference to treat that or to stop that, the growth. There is something wrong, correct? And then there's so many modalities of treatment for low back pain, but still it is going up and up and up. So that's one thing that you need to remember. Okay? Next. Again, our textbook or what we were taught in medical school, the causes of low back pain. Alright? I will share the slides with you all. You all can, I will share the slides, you can have a look when you're free. Alright? So, textbook or medical school explanation, I think Australia also taught the same thing, isn't it? All over the world, they teach the same. Alright? Also, low back pain, your physical, lifestyle, social, now they have increased emotional, comorbidities, cognitive, all these causes could cause the low back pain. Do you agree? No. Anybody disagree? Right? This is what has been taught, what has been instilled in us. Okay, all these issues can cause you low back pain. But if my question is, if you know all the causes, you can get the treatment, right? Why still 85% you can't identify where the pain is coming from? End of the day, they will blame it on emotional or cognitive. Correct? And the moment they can't find anything, they'll put blame on that. So 85% they blame it on them. Or because of the emotional, you are stressed, at this and that. But how are you going to treat them? That's the problem. Alright? Next. So now, for the first part I explained everything. Do you really think those are the causes or the triggers? Okay, go back to the one more slide. Okay, now these are causes or triggers. What do you all see?
Triggers.
Okay, now I'll go one by one. Dr. Mani, what do you think? Triggers. Causes.
I think it can be both, to be honest.
No, you only can choose one. A or B.
Then I will say causes.
Okay. Causes. Triggers, causes.
Triggers.
Triggers. Triggers. You cannot say as well. Triggers. Hidayah? Triggers. So when I said, I attended my motorway course, so it knows the answer already. Okay. So most of you all say triggers. Some say causes. I'll ask the same question again at end of the session. See whether those who are saying triggers or causes, are you changing your mind? We'll see. Alright? Next. Okay. What I'm saying now, those are triggers. I agree with those who are saying triggers. Those are saying causes. Still keep your mind open. Keep your mind open. What I'm telling you now is the actual root cause of all the musculoskeletal issues that you are having now are due to first your limb length difference. 90% of us human have left and right leg difference in length. Only 10% have equal left and right leg. This is not what I'm saying, there is statistics as well. Studies have shown 9 out of 10 have limb length difference left and right leg. Only 1% of that. We have 10 people here, only 1%. That's why we don't know whether you follow that 1% or not. Alright? So,
Mine short.
you're sure.
So one day.
I would thought you would tell me yours is the equal one, the best person. At least finally I can see the legend that has an equal length. But okay. So up to 2 cm, you don't see the difference. It means you don't up to 2 cm difference in your left and right leg, you actually don't see whether it's shortening or not. More than 2 cm, that's why you have obvious limp, obvious changes you can see in their posture. Up to 2 cm actually you don't see, but the 2 cm makes a difference as well. Studies have shown 1 mm difference between your left and right leg length difference will cause you issues. All you need is 1 mm difference in your left and right leg to cause you the issues. Alright? Keep that in mind. Next, the foot. Alright? All of you know that we have the arch. How many arches we have in the foot? Anyone?
3.
3, Dr. Mani? 3. Stop. Stop. Just guess. 2, 3, 4, 5, just better.
2.
2, stop.
3.
Bro? 2 or 3, okay. Hidayah? 2 or 3? 3, okay. We have 3 arches. Alright? So, if the why the arches are important, I'll explain later. But first thing I want you to understand that limb length difference is very important. Okay, studies have shown 1 mm difference is good enough to cause you issues. Alright? Okay, next. Okay, coming to limb length difference. Why I say it cause you issues? You look at it, you look at the person who have balanced limb length difference. From your knee, your hip, your shoulder, everything is straight. That means there's no one-sided
Compensation.
one side compensation, one side the muscles are tight, one side the muscles are loose to compensate. So when you have a limb length difference, logically speaking, will you have issues or not? Alright? Logically speaking, see what you are tilting already. So you are going to have musculoskeletal issues, whether you like it or not. Correct? Okay, let's ask a non-medical person. Logically speaking, do you agree with me? Yes. So you'll be regretting why you brought me here today. Alright? So these are the why the moment you are tilting one side, let's say 1 mm makes a difference. Your muscles are already imbalanced. So once the muscles are imbalanced, the way you walk, the way you think, and plus, unless you are slim like me, that's okay. No, if you are oversized, that's another problem. You have the issues faster. Alright? Next. So again, this is studies done by a physiotherapist in Germany. This study shows that 1 mm difference will cause you musculoskeletal issues. All you need is 1 mm. No, you don't have to have 2 cm or 3 cm. Okay? Next. Okay. Coming to the arch of the foot. Okay? Why the arch of the foot is important? Why the arch, how the arch functions first of all. Alright? First we have the transverse arch. Transverse arch is actually gives you the strength and flexibility of walking. If your transverse arch is not proper, the strength and the flexibility of walking is lost. You must understand that. That means the way you walk is not, you get tired fast, you have leg pain because there's no flexibility, there's no strength. Alright? Coming to medial, okay, medial arch actually distributes your body weight and acts as a shock absorber. Let's say you lose your medial arch, or your medial arch is not properly in place, alright, in proper shape, you actually lose your distribution of body weight and shock absorption. So the moment you lose your distribution of body weight and shock absorption, again that's where your pain comes, correct? Because you are losing that. Coming to lateral longitudinal arch, if that arch is not good or not properly shaped as well, you're going to have imbalance in stability during walking and balance. That's why you lose your balance. You lose your balance, your lateral arch is not proper. So, in medical school, we were not very much concentrated on this, correct? They didn't go into this in detail. Even I learned in detail after I got involved in statistics, right? So, how the arches help and why we need all these arches into place, correct? So, you understood about the arch, why these three arches are important, and you need to correct all these three. Most of the products or whatever you have in the market is only correcting the medial arch. If you see only have one bulge on the medial side, rest all will be flat. What's the point correcting one arch? Who's going to correct the transverse and longitudinal and lateral arch? That's the question, correct? Keep that in mind. What you have seen so far is already one bulge on the medial side. That's it. Because most of them have flat foot, the medial arch will help a bit. That's the concept. But keep your mind open. I'll tell you why we need to correct all three arches to have a proper musculoskeletal prevention of the disorders. Alright? Next. Okay. Now, we spoke about the limb length. We spoke about the arch. Alright? So, how to determine whether the arch is properly shaped or not? That's how we do the footprint. From the footprint, we will know which arch is affected, which arch is not. If you look at it, this is the perfect one. Alright? Let's see afterwards, we'll do a footprint for everybody. See who has the perfect one. Okay? I doubt we can see today, but if I can see today, I'll take a photo of you and keep it in the office. Because so far I'm looking for the perfect arch I have not seen. Alright? So, first thing, flat foot, if you see the first one, that flat foot, this one, where your footprint will take over the medial part, that means your medial part is down, there is no arch at all. So that's how the medial arch is affected. Alright? If you look at the analysis done, alright, those who have flat foot, the muscles are loose and long. That's the reason why your muscles, why your foot is flat, because your muscles are long and it's loose, so it drops. Okay, you lose your medial arch, and analysis shows that those with flat foot have tired, sore feet, and lower body issues. That means you have low back pain and below. Those who have flat foot, they will experience low back pain and knee pain, ankle pain, all those stuffs. Alright? Below hip problems starts with improper or not well shaped medial longitudinal arch. Okay? Understood? Clear for now? Alright. So, coming to high arch, again, is because of the tight and short muscles. Okay? People have concept of high arch and flat foot. They think it is because of the bones. It's nothing to do with the bones. You must understand that. It's because of your aponeurosis and your muscles and the ligaments. Alright? So that's how people think about my bone is shaped like that. It's not. It's actually the muscle, ligaments, and aponeurosis that we have. Again, next you can see pronation again, your middle arch is lost, a bit of transverse arch is lost, you get pronation, supination, and then bunion formation. You can see a lot of people will have the bulge over the middle aspect. That's again because of too much putting compression on the front of the foot. That's where the bunions comes in. Alright? So there are actually the bunions, actually you can correct it back to the state again. There are certain techniques that you can do yourself. Alright? Actually bunions are this is calcification because the bone is trying to make it strong because you are putting so much pressure. It calcifies more to make the body is making it strong at that area. That's how the bunion forms in. So there's a free exercise that you can do at home where the bunion actually can break down the calcium deposition and then become straight again. Alright, there are avenues to do that as well. Okay, next. Sorry, before that, go back to the thing again. So again, those with tight short muscles, that all those the high arch, pronation, supination, bunion forms in. The analysis shows they have from hip and above problem. This is all analyzed, alright? So those having these issues are very prone for headaches, neck stiffness, and upper back issues. So most of the patients that when I do the footprint, I look at the footprint, alright, you can see that's
Sorry,
right,
Jay.
right, 20 minutes.
When you
That's it, 20. So most of the footprint that when we do a footprint, you don't even ask, you don't even ask what are the issues they have. From the footprint, you can tell the patient either they are having the issues or they are prone for these other issues. So later, I don't know your medical history, none of you all I know what issues are you having. Let me your footprint, I'll tell you whether you have tell me whether you have that issue or not. Right? You don't tell me what you're having. From the footprint, I can tell you what are you prone for thing. Maybe you're not having it now, but you are very prone for what you're going to have. That's how elaborately you can actually interpret the footprint and advise your patient. Actually, the patient actually will be amazed with what you can tell them with just the footprint. Because I got amazed, that's why I got involved in this. Alright? Okay, next. This now was a shape. Okay? Now we go into the pressure points. That means with the footprint, first thing you know the shape already. Next you will see the pressure point. This again, the pressure is evenly distributed. Again, perfect. I'll take your picture and put it in the frame and keep it in the office. If you have any of you all got the equally distributed pressure, okay? And then again, analysis and studies have shown that those who are putting too much pressure on the hip, they are very prone of developing low back pain. Alright? Those who are putting pressure on the toe imbalance, pain, migraine, pain over the shoulder blade. Those who are putting front of the foot, burning and numbness and motor neuroma as well, because you're putting too much pressure on the front of the foot. And again, too much on the left front of the foot, shoulder pain. So most of the time when you see this pattern, you ask your patients, are you having shoulder pain? They'll say yes. Are you having low back pain? They say yes. Maybe not now, some are young, they say, no, I don't have anything, but you can advise them, you are prone, you need to do something now. It's just a matter of time, you're going to get it. That's why I say, all these problems starts at which when you age what? 40. Alright? So, some starts at 40, some starts at 50, some starts at 60. But with current generation, it is starting earlier. If you look at it, alright? Current generation, last time we used to play, jump, climb the trees, nothing happens. Now they fall one time, they say they want to go for knee replacement. You know, that's how the situation is. Alright? So, the age gap for low back pain, it is actually dropping. Those statistics were done a long time ago. They said 40 years old, but actually it's dropping because of the sedentary lifestyle. There's no more, children are no more playing outside. They are all playing inside the house. Most of the time sitting and doing games. Correct me if I'm wrong. Correct? No? Oh, he's out of it. Says he doesn't agree. Okay. So the incidents are dropping actually. Alright? But we still keep it as 40. That's why I said, why it happens when you are 40 years old? Any reason? Why it's not happening immediately? Since you are born like that, you are born that foot, it's not like it happens. The question comes now is, why it starts after 40 or after certain years? What do you all think so? Any reasons? Wear and tear, okay. Anything else? Okay. Now, go back to the problem of causes of low back pain. Remember? They say causes. Some say it was triggers and some say causes. So, you were born with flat foot, for instance. Or you're going on in your life, then you put on weight, and you start working, you start doing things. As you do and do more and more, because the muscles are still one side tight, one side is loose, correct? One wrong thing you do, it triggers and gets you the pain. You understand what I'm saying? So the causes actually triggers the abnormality in you and causing you the pain. Because the root cause has already been there. Some survive up to 40, some survive up to 50, some may not even have any pain, even though they have discrepancies in limb length, because they might be having a better lifestyle. They are maintaining their weight, their food, they are exercising. So it is not necessary you have this issue, you are going to have the thing. But looking at it, current situation, most of us will have the issue. Alright, so by correcting the root cause, you're actually preventing one thing. Number two, you're also addressing the issue that you already have. So what we are trying to do now is, if you tackle the root cause in the beginning itself, in long run, you actually, whatever triggers that happens, you're not going to be affected. That's the whole concept. Coming to osteoarthritis, why is osteoarthritis? It's a wear and tear issue, right? We're talking about rheumatoid, we're talking about OA. OA is again is wear and tear issue. Why some wear and tear is earlier, some wear and tear is okay, some wear and tear never happens. If we have imbalance, like limb length difference and then your arch is imbalance, again the wear and tear is even worse, correct? Just take your car, for instance. You have one tire less air, one tire more air. What happens? One will wear faster, one will last faster. Will be last longly. So same concept. Our body is the same. Our body is actually designed to treat itself. We don't need actually need external medication to actually be designed so that the problem is our food and our lifestyle habit that we need to pop up so many medications to correct them. Alright, so same concept. You repair the root cause, that means you tackle the root cause, the body will take care of itself. That's the whole concept. Alright? That's one thing. Number two, when you correct your posture, when you correct your arch, when you correct your limb length difference, I'm sure you all have gone for massage, foot massage, right? They have certain points they press to stimulate certain points. Our foot is actually, when you walk, why they ask you to walk or do something, don't sit, keep walking, have some more exercise. Because when you walk, if all your three arches are good, when you walk, that pressure points are automatically activated. That means you are doing your massage by yourself and activating all the nerves, because each point corresponds to each body organs. So all your body organs will work fine and you'll be healthy. So now your arch is not correct, it's all haywire, you're not going to get a proper pressure to do the acupuncture as well. That's another concept on all these things. So means you're not only addressing your musculoskeletal issues, addressing your overall health as well. Alright? Okay, next. So, for musculoskeletal disorders now, okay, now we already explained about all that. Now, coming back to musculoskeletal, we already saw the causes or triggers that I'll ask you later. Now, coming back to treatment options, okay, what are the treatment options we have at the moment for musculoskeletal disorders? Alright, what we give, we either give painkillers, we send them to physio, chiro, acupuncture, alright, and then there are also orthotics that we will discuss about that. Next, worst case scenario, surgery. Alright, all these painkillers is again subjective, plus it's only for a certain period of time. Alright, once the medication wears off, it's going to go off, the pain is going to come back. Alright, physio, chiro, acupuncture, it's the same thing. It's for a time being, unless you continue doing it, it's going to come back again. Alright, surgery again, we don't know whether we can correct it or not. There's no surgeries to correct the arches at the moment. They can go for low back surgeries and all those type of things. Correct? So that's why we're going to concentrate on orthotics now. Okay, first, if you remember, the root cause we agreed, some of you, not everybody, some of you agreed that those are the cause of the low back pain is the triggers, some say causes. Alright? So now, of all these 4 treatments, what do you think will address your root cause?
Orthotics.
And you go one by one. Dr. Mani, what do you think?
Staplex.
Okay?
Correction.
Correction. With orthotics, correct? Dr. Suraj?
Orthotics.
Doctor?
Orthotics.
Dr. Raja?
Orthotics.
Orthotics.
Now, you?
Orthotics.
Okay, now you're convinced, huh? That's good. There? Okay. So, again, we are only doing symptomatic treatments when you're doing painkillers, physio, and surgery. Correct? If you don't correct the root cause, this problem is not going to end. Not going to end. It's going to come back again and again. Correct? So, then with that, do you agree? Shall we change the term general practitioners to symptomologist? General practitioners, what we are doing now, we are only treating symptoms. If you agree with me or disagree, please let me know. Because we look at it, we are only giving medication for the symptoms, but we never thought about the root cause. I was the same mindset till I did my diploma in Ayurveda. That taught me, because those treatment, the ancient treatment, alright, they look at the root cause. They never looked at the symptoms. So, the modality of treatment of Eastern medicine, I'm talking maybe Chinese or traditional medicine, they never go for symptoms. Modern medicine goes for symptoms. You look at traditional medicine, they treat the root cause. Root cause elevate the symptoms. Alright? Modern medicine is treat the symptoms, cause I'm not bothered. You come back again next week. We have to be truthful enough. Alright? I admit I was doing the same thing. So that's how we need very, I'm not only talking about musculoskeletal disorders. I'm talking about any other diseases that we are treating. We need to start looking at what could be the root cause. Then we can treat our patients better as well. Alright, we need to open our mind looking for the root cause. Alright, next. Again, this is for the painkillers issues. Okay, they have done studies by the Lancet. Okay, they have tried with opioid use with the placebo for low back pain. They found actually no significant similarity compared to placebo. So what you see, painkillers actually considered is just playing with the mind. They have done studies. They said even they give placebo and painkillers, people have the same effect. So that means the painkillers are not actually working on them. So we are actually pumping up painkillers with opioids and everything. We are making it worse. Alright? Not I'm saying it, these are all studies again. Alright? Next. So coming to orthotics. Alright? Orthotics, there are 2 types. They are custom made and they are also prefab orthotics. Alright? Custom made, both of the podiatrists they will do now for you. Podiatrists will do the orthotics. But the issue with podiatrics orthosis is they shape your foot with their bone. Alright, podiatrists, what they do, they use the shape of the bone. But the issue is not the bone. The issue is your ligaments, their aponeurosis, and your muscles. What's the point shaping the bone when the issue is something else? That's how custom made the podiatrists make shoes sometimes only will affect for a while, after that it comes back again. That's another issue with the podiatrists shoes are made. Alright? Prefab orthosis, another problem is they only look at the middle part. You only actually, most of them you see even the shoes that Skechers or some now, most of the shoes that come, they have a arch support, you only have a bunch on the middle side. So you only correcting your middle arch. What about the transverse and lateral? Alright, that's one thing, keep in mind. So again, studies showed there's no difference between custom and prefab. This is also study shows that it doesn't make any difference. You can go for custom. Customs are always cheaper. Always more expensive. Prefab are cheaper. Alright? Okay, next. So, before coming into StepFlex, this is what the product we're going to talk about today. Alright? I would like to share with you how I got involved with StepFlex. Alright? So, I was in Melbourne. I attended this. They have this Melbourne home shows. They have all the shows all over. They have this current. I think you will know whether show they have. So in that show, I just arrived from KL to Melbourne. So I went for the show and my back it was 8 hours flight, right? So I went for the show. So they were doing free footprint. Okay, orang Malaysia free mesti lah masuk, kan? So free footprint, okay, tak apa, free tidak masuk. So they did a free footprint. He looked at my footprint. He said, "Are you having low back pain?" He never seen me before. Then I said yes. Then he said, "Okay, great." Then check. Then he give me the size. Okay, put in your shoes. Put in my shoes. The pain, the low back, the mild pain I was having immediately gone. Then I was walking better. My wife asked me, "Are you acting or what? You have low back pain?" I said, no, I feel better. Then I bought a pair, my wife got a pair. Bought, then I used to use, I go for walking and everything. Previously, I'm flat-footed. Alright, so previously, if I go around the lake, one round is already paining, already ankle, knee, everything already pain. With that, I could go for 2 rounds, 3 rounds, no pain. I feel less tired as well. Okay, that's good. That's how I used for 2 weeks. I went and hunted the owner of the StepFlex, and he's apparently in Melbourne, and then got the distributorship for Malaysia. Because this is a very good product, I thought I need to bring it to Malaysia. And then I thought this product is something new. Guess this product has been there since how many years? Any guess?
20 years.
Just guess just roughly.
10, 15 years.
10 to 10 years. Search.
10 years.
10 years. Stop.
20?
It's Australian product, huh?
20 years?
20 years. Stop.
20.
20. Raja?
30, 35,
30, 35. Dr.
20 years.
20. 20.
20.
20. You there?
10.
10.
20, 30.
Yes. It has been there since 1974.
Wow.
74
So, this is not new. I was thinking this is some new invention, new technology and everything, but it's not. He told me it's been there since 1974. So they were actively marketing towards the Europe and they have not come to Asian side. Because of the cost, but I'll come to the cost later, but the product is actually very, very good. It solved a lot of problems. I've given to a lot of patients in Malaysia. Usually they all don't come back with back pain anymore. Because how well the product is. Alright? Okay, now just a little bit history how I got involved in this. Some of you are wondering how come some from doctor he's selling this insoles? No. That's why I got involved. And then I thought I need to share this with our GP friends, and this is only available for GPs. It will not be available on shopping complexes or pharmacies or anything. So we want to educate the GPs because you are seeing the patients, and this is going to be some extra revenue for the GPs. That's what under MHSP we are thinking. We are trying to bring more products for GPs to improve their, because you cannot keep on selling cough and cold. The market is now changing. Alright? So again, this product, okay, so what's the difference between the conventional orthotics, prefab orthotics and compared to StepFlex is, I'll pass it to you around, okay, this is, okay, they comes in two, okay, another reason is conventional is, if you look at the orthotics or the insoles, they say, people know insoles, is unisex, alright? Then you cut the sizes and put everything. Is male and female's shape of the leg foot is same? You tell me. It's not. Female shapes are narrower, male legs are broader. Correct? So how can you use one product for both? That itself is wrong already. Alright, so that's why you see this is both size 10, W is for male, N is for female size. So if you both are size 10, I'll pass it around, you see, you will find that, you see, the male size is broader, female size is narrower. So you need to have this difference for male and female. You cannot use universal size for both sexes and you're not going to get a good results. Alright, that's another reason. Okay, why this works superior to any other products in the market and it solves a lot of issues. Okay, now another thing you see the correction of the arches, all three arches. From before, once you put it becomes straight. Why? It corrects all three arches. Okay, that's how you'll see there's a middle bulge is here, lateral bulge is here, and then the dorsal bulge is here. Alright, that is one thing on the correcting the arches. Another thing I'll show you is you will see the shape here. Can you see the gap? Let's say, can you see the gap? Alright, you all see the gap, right?
Yeah.
Alright. I said this corrects up to 2 cm limb length difference. One leg is long, one leg is length. So up to 2 cm, what happens is the longer leg will press more and go down. The shorter leg will press less to equalize your length. So that's why I say not only correcting the arch is important, correcting the limb length difference is important. So up to 2 cm, this will correct, make it equal. Alright? More than 2 cm, you need to go for custom. You cannot use this. Alright? But from 3 cm difference, you make it 1 cm difference, you are still going to have some benefits. Alright? So that's the concept. Even though you are 2 cm more, you're narrowing down the imbalance lesser. Alright? If you still, because we are not going to measure how many cm difference is there. Alright? I'm just going to give you training afterwards how to assess the limb length difference as well. Very simple method of showing the patients what's the difference, how to see the different difference. But we're not going to measure the cm. So you can safely give them this to use. Alright? So I'll just pass you it around. You can see the broad, how it feels. It is mixture of silicone and other base, and the product is made in Germany. Alright? The founding company is in Australia, Melbourne. Product manufactured in Germany, and they give you 5 years warranty. So let's say the product cracks or breaks, they change 1 to 1. So the same size, female, male, and male will be different because that's how it shapes with the foot. Alright? During the demo afterwards, I'll show you how you can see the immediate difference pre and post. Since we got a model here, very good today, we are shown with the model.
Dr. Ben,
Yeah,
I
yeah.
have a question.
Yes.
How long do our patients have to wear it, and do they have to continuously wear it until?
Okay. It is actually, it's a correcting device.
Yes,
You can
yes.
see,
It's
right?
like braces.
Yes. If you take it out, your foot is going to fall back again.
Right.
So, whenever you wear shoes, you wear it, alright? Maybe after about 2 or 3 years, the memory will be there. You can actually wear without for a while, and then of course, again, because you're already imbalanced, this is actually correcting everything. So you need to wear it continuously. Of course, you wear outside, come back home, the memory will be there, so you don't need to wear inside the house. So there are some housewives, alright, that have issues they have bought. So I tell them, unless you're going to wear a shoe inside the house and walk around, then don't waste your time buying it. You're only going to use it for going for weddings and parties and shopping. It's not going to help much because they are mostly in the house. So if you're mostly in the house, suggest you buy a sports shoe, wear it in the house and walk around. Australia, I mind, they everywhere they use shoes. Tidur pun pakai kasut.
Yes.
So they are no problem. So Malaysia tengok datang sini pun kena keluar slipper.
Another question, Dr. Ben, is
Yeah.
do they have to keep changing the sole as the foot?
No,
No.
because this one, it molds according to your arch.
I see.
What is needed, it molds and comes to you. That's why it's soft. It molds. Yes, come. So it actually molds to, let's say your medial arch is good, only your lateral arch is, so you only correct the lateral arch.
So it's a one-time purchase.
One time purchase.
I see.
Previously they were giving 10 years warranty. People were misusing the warranty. Then they reduced it to 5 years. But actually once it's bought, I think it lasts for lifelong. Right? I've been using mine now close to 4 years already. So no issues.
So people can go jogging with the sole in?
Yes.
Oh.
So what advice is, first you use it for walking first. Don't strictly put and walk, run. Because if the foot is then need to adjust it. Because first 2 weeks you will feel some amount of uncomfortable feeling. After 2 weeks you will not want to leave house without it. That's how the feeling is. You feel much better. So let's say you're having low back pain, all you need to do is just don't rest. Put this insole,
Stand.
go for a walk, you come back, the pain is gone. Because it all the tightens, all the muscles, everything get balanced back. That's how it works. Sometimes when I have a low back pain, traveling so long, I just put my sport shoes and go for a walk and come back, it's gone. No one taking painkillers. Of course, it's not good for business, but we need to teach what's the correct thing now.
How about patient with PID and
We can try, because again, it's posture. Alright, posture is one of the reason the posture, the root cause is still there. You can say, no, there's one patient that is using, she's 18, is it? 18 or 20 years old? 18 years old is using. Alright, so she's have given some good feedback. I think Dr. Suraj will share later. Alright, she just started using a week ago or 2 weeks now.
Going to 2 weeks plus.
Alright, okay. Next. Okay, this, so have you heard about IDEC spine check? Anybody of you all, any experience? Okay, this is actually a small device, alright? So you just run through your spine, it scans your spine and gives you a report. Alright, this machine is from Switzerland. So how I got involved into this machine is, in Australia, they Medibank, you should know,
Yes.
right? Okay, Medibank want to approve the claim for private health insurance to claim for this StepX. So I'm medical director for StepX Australia as well. So what happens? So the founder told me, Ben, how to, because they want to have scientific evidence. Whatever I'm saying now is you can just say I'm just simply saying, correct? What's the evidence? So to get the Medibank to cover the cost of the orthotics for the patients under private healthcare, they want some proof. So that's why I found this machine, a device from Switzerland, demonstrated the difference with the insole, the orthotics and without. So if you look at this, the higher the score, the better it is. That's how the inference is. Alright, let's not go into too much of the details. Okay, so this is before putting the insole. That means on the 3rd of June, 23rd April at 10 AM. This is before. Okay. The score for posture is 26, 58 and 42. Immediately at 10:19, okay, same date, after putting the insole, another reading was taken, scan is done, you get 52, 59, 66. Immediate. It's not like after 2 weeks you see the different 2 weeks. This is what we demonstrated to Medibank. Medibank now covers this truly. You have Medibank card, you can go back to Australia. All you need is a referral from GP, Cairo, podiatrist. Then okay, this patient needs orthotics, StepX orthotics is fully covered.
Is it only for Medibank though?
At the moment, Medibank, I think NIB came in as well, not sure. But Medibank is the one, the first one we went in to show them the scientific proof. Because they want to know the scientific data. So that some of you, this machine is available in Malaysia as well now. Alright, there's DBC physiotherapy, they have the machine. If the patients are really not convinced, you can send them there. pre and post to show them that your posture actually corrects immediately the moment you put your insole in. Logically speaking, alright? So this is another way to demonstrate to people. This was a convincing point for Medibank to come in. Alright? So Australia, Malaysia, we don't bother trying because that will never happen. Alright? Yes.
I have a patient
Yeah.
with scoliosis adult, and he's very prone to, every time he goes to the gym, he will
Okay.
pull a muscle, he will come back for anti-inflammatory. Will
Okay.
this help him?
Okay. How bad is scoliosis?
Quite bad, the top part.
Okay. So he's having issues. He pulls his back on the top
When
part
he
or lower
go
back?
lower back.
Okay. It will help the lower back. Because top part, because of scoliosis, you can't do much unless that is corrected. Then you can't do anything. But apart from the area of the scoliosis,
The normal part.
the normal part,
Yeah.
if he's having low back pain, is he overweight?
No, he's very skinny.
Very skinny.
Yeah.
Most probably he's having low back. We can do the footprint for him. We can assess what are the issues. From there, we can advise.
So treat him like a normal patient.
Yes.
I see.
Because I'm sure, I'll tell you what are the techniques to use. You check on him that first. If that all ran, it's already lari, this will help you. I tell you the two, you check the limb length and the arch of the foot, you know whether it can help or not. If those are perfect, then the scoliosis is the problem, we can't do much. But these two, he falls into these two category, we can actually correct those things and help as well. Plus, he goes to the gym. Again, when you are lopsided, when you do gym workouts, again you're stressing on the wrong part of the muscles. So that will help actually. Alright? Okay. Next. Okay. Before the coming to the conclusion, go back again one slide. Okay, now I'm going to ask again the causes of low back pain. Okay, I think Raja and Louis just came in, so we'll excuse them. The rest, again, I'm going to ask the causes of low back pain. Are they causes or triggers? Okay, Dr. Mani? Triggers. What are the causes then?
Because actually they have some kind of anatomical problem.
Alright.
They need something to trigger the pain. So
Alright.
when it triggers,
Alright.
what kind of activity they're going to do, what
Yes.
kind of job they're going to take it,
Yes.
all those things may trigger the pain.
Yes.
Then the causes are already there.
Yes. That's
So
the same.
yeah.
The root cause is already there.
So
This
they need
comes
some
triggers.
trigger factor to get the
The
pain.
pain back. Alright. So causes or triggers?
Triggers.
Triggers. Doc? Doc? Triggers.
Triggers.
You have to admit triggers. No choice. Okay. So I'm just you don't have to say it just because I'm saying it. If you think there is a point that you still think those are the causes, let's talk about it. Because it's for our knowledge as well. You don't have to agree because I'm telling you it's triggers or I'm trying to bring you towards the trigger point. But does it make sense or not? What I explain, you think yourself, does it make sense? So, what are the causes and what are the root causes? So, root causes again, I say, correct? Next slides. Alright, so now we know the root causes. Your limb length difference and your arch is not in the correct arch or correctly postured arch. Alright, so now we know the root cause, so we need to know how the head muscular relaxation is easier. Once you know the root cause, I'm telling you, once patients start using this, they don't come back to you for muscular disease anymore. But look at it, you actually, I'm telling you, you don't look at some people look at it then they don't like. For instance, I had a presentation for a group of physiotherapists. Alright? They agreed like what you all agreed what I said. But they're skeptical to take because they're scared of losing the patient. Because I am treating them once and for all, they don't want to come back to me for physio anymore. That was their mindset. Now I'm selling them, they're selling 10 sessions, 12 sessions to come back for the low back pain. After a few months they come back again because now I'm going to correct this is what I'm going to come back. Okay? So we GPs should not think like that. you treat one person, they are happy, they're going to bring for you another 20, 30 people. Think of it that way. Alright? They're going to bring for you another 20, 30 people or more. Because look, I went to that doctor, I had so many issues for so many years. One thing solved all the issues. The best you all could do is, you all should get a pair, you wear it and see first. What are the difference that it makes in your life, in your posture, the way you walk, how it solves all the things. Once you are convinced that, for me, I used it first, I know how it worked. The moment I got convinced, it's easier for me to convince people. Alright? So later, you have a demo, nanti sediakan kopi dulu. So we have a coffee break now, alright? Let's settle the arrangements. After the coffee break, we'll do a hands-on training on how to do the footprint. So we will do the footprint for all of you all, alright? And then I will show one you all can do for the others so that you have a hands-on as well. It's very simple. It's not a big issue, alright? Once you do that, then after that, once everybody is there, I won't analyze first. We'll analyze all your footprints together. Alright? We do that. That's how we will go to that. So another thing that can do, okay, now we do the footprint and then we analyze together. That's the better thing. So now coming to question and answers. Alright, do you have any questions? Any doubts? Anything? Or you want to share something? All good? You all understood?
Adult size, isn't it?
Pardon?
This is adult size, isn't it?
No, it's male, female. There's no adult sex, it's male and female. See, if you look at that, this W is for male,
Okay.
N is for female. So you look at it, both are same sizes, but this is narrower than this is broader.
Okay.
So why? Because male legs are broader than female. So the product out there mostly is all one size fits all. That itself is already wrong. So it has to be it has to be shaped along with the female size or the male shape and female shape. So that gives you the age.
You're wearing a good foot, right?
So this one is, what is what size?
This is 10.
Size 10.
This is 10. That's 10. This size 10.
So it does not extend all the way to your...
No. Because see, arch. If you go back to the arch, Vanessa. The arch. You see, your transverse arch is here. There's no point covering the whole foot. It's not necessary. So this corrects your transverse arch. That's why it stops here. This will cover your lateral, and this will cover your medial arch. That's why you will see that once you wear, you will see the bulge. You will feel like a golf ball. You won't see the won't feel the bulge on the left or right. You will see like a bulge on the like a golf ball bulge. You will feel on the feet. So that's how as you walk and walk, you will all the thing will be elevated. That's why it works.
I'm assuming it's not going to fix any bunions for this one
It will stop
from getting worse.
getting worse. There's a certain exercise
Yeah.
you can do, but you need to wear these continuously on a daily basis. And then you come back home, I'll teach you an exercise that we are also doing some studies now, become straight back. Actually can dissolve the bunion and become straight back, but you need to do the exercise. You need to predict the things. Alright, bunions can be corrected without any surgical intervention.
Because
Right,
that's
but-
what most of
Yes.
the current practices are. If it's really bad, it's use surgery.
Yes, so now you stop it from getting worse by using this, because the moment you elevate the pressure from the front of the foot, the bunion will not stop growing already. Alright, and then you do the certain the maneuver that I will teach, that will break the calcification and become straight again.
So assuming this sort of insoles are only compatible with shoes that are for things like orthotics and or
Not
just-
necessarily.
not necessarily.
Any shoes,
Yeah.
that has support at the back, means it doesn't slip off.
Okay.
Because when we putting it all the way back. So this is where your
Yeah.
heel is faced.
Okay. Alright.
So if you wear slippers,
Yeah.
it's going to
Yeah.
keep on coming. Even though you have sandals that have a back covering, you can still wear it.
Because in like custom orthotics, usually you have to wear specific shoes that are for orthotics as
Yes,
well.
yes.
But what you're saying is this one, it doesn't.
Any
do
shoes.
that. Okay.
I'm wearing it my sneakers. I use with my loafers as well.
It's a bit difficult, I guess, if you're for female who usually wear pointed shoes.
Yes,
That might not
yes,
be.
yes. Because
Yeah.
high heels, of course, not advisable because you're having all these issues. So best will be sport shoes, which you don't get the one that is already coming out with arch. Nowadays we have to come arch
Okay,
support,
yeah.
these, that. So you need to get all that. That's all more expensive anyway. Get the normal one that
Yeah.
with normal insoles. Don't even have to take it out.
Okay.
Put it in. Best is for the beginning. You get a one that is shoelace one so that you can adjust the loosen up a bit.
Yeah.
As your feet get molded, it will become very comfortable. Then you can tighten up the shoes.
Mm-hmm.
Just the beginning, best is sport shoes. You can loosen up with the shoelace. No need to. Some people say get our extra size bigger. No. You use your same exact size you are using now. Don't go and get a one size bigger. That's wrong. Use the same size because your foot will eventually mold to it. Alright? And those who are flat foot, you will see your foot becoming more narrow because the flat footness is elevated already. Alright? And those with high arch then becomes settling down more flat. So that's how it works. Alright? And then it works very well for those who are suffering with fasciitis.
Fasciitis.
Yeah, because why you suffer with that? Because you're putting too much pressure on the front part of the foot. The aponeurosis gets swelled up. So now you're putting equal pressure. The aponeurosis swelling reduces, the pain goes on. But those patients, they should not wear throughout the day because the pain will be, sometimes they can't take it. Let them wear 5 minutes in the morning, 5 minutes in the evening, then next day 10 minutes, slowly pick up. Those who are already having pain. No pain, then you can actually you can start using already. Alright? So if there's no any questions.
Dr. Ben,
Yeah.
what about patients with very mild calcaneus spur?
Yes, it will help. Because why the spurs comes in? Because too much pressure at that particular point.
Mm-hmm.
Alright? That's how the spurs or all the classification comes in. So now the moment you elevate the pressure on that particular point, you are actually even those who are having corn formation, you see a lot of people having corn on the front of the foot, all that will stop. It cannot go away because it's already there. But it will be stopped becoming worse, and then the progression of the spur, progression of the bunion, all will stop because you're already elevating the pressure from there.
A lot of my
Yeah.
patients, they are foreign workers.
Okay.
So they say, oh, they want to fly back to Bangladesh to get operation. But calcaneus spur usually is just on one side. So do they
Yes.
only wear it on one side or do they wear both
Both
sides?
sides, because you need to have balance both the legs.
Oh.
You need to focus. It comes with left and right leg. You need to wear both the shoes because that's how you're going to elevate your linear difference. You need to wear for both the shoes. So even the spur, if you can go operation and come back, the problem is still there. It's going to come back again. Alright, unless you tackle the root cause, the problem is going to stop.
So these insoles are already pre-made, is it?
Yes. So it comes in different sizes. So
Oh, sizes?
yes, when I do the training afterwards, I will teach you how to do the sizing as well. So you can actually on the spot give to your patient if you are stocking up. If not, you can scan. But normally what the clinics do now is because they don't know what are the sizes to stock up, because there are 8 sizes in females, 8 sizes in males. So unless you're going to stock up for 16 pairs, then it's a different thing. But if not, normally we advise you scan and send to us. We do the sizing and send now we pack our stock in Palmerize. So when your next order Palmerize will send to you. So easier.
Dr. Ben, the
Yeah.
left and right foot will have the same kind of deformity, is it?
Yes.
Oh,
No,
It's
no,
very-
it's different.
Oh.
When you take your left and right, it's different. But the insole
It's
will
same.
mold according to what are the issues.
oh.
Like one size fit all.
You understand?
Okay.
Although the size is the same, I'll show you when you do the left and right leg. Most of the time, left and right leg is different.
Oh.
It's not the same as well. So this will mold according to the issue that you have.
Wow.
Please, correct.
I see.
So it's because one leg is wrong, one leg is short as well. You see, that also will be corrected. So the longer one will compress more,
Okay.
becomes flatter up to 2 cm. The shorter one become higher, so that your left and right leg is the same length. That's how we have this gap here. You see, the gap here is because of that. So it's
Should
going
we
up.
choose shoes with a harder base? So
Not
it doesn't
necessarily.
go down?
Whatever shoes that you're using is good enough. As long as it doesn't have a special insole inside
I see.
with the arch.
But nowadays, most of the shoes, right, it comes with nice heel pad and whatnot.
No, don't buy those ones.
Oh, so that means this one should not be worn with.
Those shoes.
For example, you take Hush Puppies or Clarks, right?
Yeah.
So they all come with very nice
They-
shoes.
if they come with the nice
Take
sponge
it
one,
out.
doesn't matter, don't take it out.
Okay, so you wear this on top there.
You just put this on top of that. Don't buy the one, there's some shoes will have a medial bulge because they will tell you, give you arch support.
Okay.
Don't get one. Your whatever cushion inside the shoes, don't take it out.
Okay, maybe later I'll check with you.
You should not take out. Because if you take out that cushion, straight away it goes on from the hard surface. And then the correction is going to be difficult as well.
Oh.
Don't do that. Because some of the insole they sell, you take out the old one and put this one inside because that one they have the gel and all these things. But that's how it goes.
It comes with the memory insole now, already. You step on it, it fixes your leg like that. So those kind of ones also cannot body size. You have to remove that layer.
If you remove it, because what I see the memory insole you're talking
This one
about,
is a black.
you are stepping on an insole, alright?
I see, I see.
And shaping your foot. The moment you shape your abnormal foot, what's the point shaping an abnormal foot
That's why I
and putting it in?
Oh.
This,
Understand? No? That's the concept.
it just looks sengit to me.
Alright? So I think once we do the demo, you will understand better how it truly works. Alright? So I hope the tea is ready, so you all can have some tea and then
Oh, I have one question on it. Two. So immediately
Second one taking road.
how long did they
So
tell you
we will stop for a while, you can go for a toilet break while she's preparing the queen
2 weeks.
for morning break.
2 weeks? We won't follow the timeline, not 2 weeks.
No. Dr. Ben said no need to follow. If the person is comfortable, you can wear as long as possible.
So how's your experience with the patient?
She's good. I mean, she doesn't have this ankle pain anymore or knee pain.
I think maybe Dr. Suraj can explain while we are waiting your experience with the patient.
There's a 18-year-old girl,
Okay.
Malay girl.
Uh-huh.
Actually, the father is not brought to the clinic. Actually, came for back problems and knee pain.
Alright.
Constantly, she had all this, even ankle.
Alright.
So I told, because she's quite young, only 18 years old. So but actually, father only did the MRI for her when she was 14 years old.
Okay.
And he said she has a prolapse disc.
Okay.
And so the father quite frustrated every time, the doctor is complaining on knee pain and all these joint problems. So I did all the blood tests also, arthritis
Okay.
profile, everything came, nothing there.
Alright.
So then I told about Stepflex.
Okay.
So I told the father, why don't you do a footprint and so on.
Alright.
Oh, it's very bad flat foot,
Okay. Yeah.
and both very bad flat foot. So I told the father, I think, I recommend for your daughter to wear this. The father immediately, because he said, I'm so frustrated, going clinics to clinics and taking painkiller, and how long she's going to take on painkiller, only 18 years old. Then only I contacted Ben because he's 18. So is it, then worry about, yearly he has to change the size. Then Ben said, if 18 and above,
It's not a problem.
it's not a problem. So then ordered from Ben. Then I told her also, like what Ben told, to have just normal shoes, no need any bulge, flat one. So then she brought to the clinic and told her how to put it in everything. Then immediately she wore it, she said it's quite okay. She didn't feel any like the golf ball sensation.
Alright.
I think probably she's quite young.
Alright.
So she's immediately she walked and immediately you can see how she stood up.
Okay.
Her posture.
Straightened up.
Yeah,
Alright.
she immediately stood up like straight. So I told her to wear. Then after 2 weeks, I called her. So I told her how is it. She said, doctor, no more this knee pain and all this pain and everything.
Alright.
Uh,
So she said, what's the posture? She said, once you address the root cause, you can actually elevate a lot of your patients from painkillers, unnecessary painkillers.
Because every time she came, when she came to me, every time she kind of a bit slouchy,
Okay,
and
yeah.
when immediately when she wore that, straight away she's, it corrected her posture.
So let us we'll do the demo approach. You'll see the difference between with and without. You will see the difference much.
So this one now, the second patient I'm going to bring from Ben,
Alright.
also Indian man also. So he is also having knee problems,
Alright.
quite young, about 40 plus.
Okay.
So I told him earlier, he said he's a contractor, so he said no, straight away he said order for me. Okay, he said I have to work, so I don't want this problem later to become worse.
Yes. How old is he?
40 plus, 50, I can't remember.
Alright. So all this the trigger factors are coming in and then
40 plus,
Yeah.
40 younger.
Alright. So we will stop here the first session. We have a small tea
Another,
break.
then
Yeah.
if how about elderly patients?
See,
Maybe a patient like maybe 60 plus or 70 with
my mom is 76. Right? She had OA. So I gave her to wear. But the problem is, they don't like to wear shoes in the house.
in the house.
That's the biggest problem. For sports also, no, I cannot. They are not the people that wear shoes in the house and walk.
But outside she wears.
Outside she wears. But how
But
often does she go out?
does she feel the difference?
No,
When
because I bought for her, I bought her new shoes as well. She never use it. So again, it's not about it will work, but they need to use it
Yeah,
for it to
who
work.
will choose that?
No, but if the patient
Buying
agrees
is
to wear,
something,
then
using is
it's
another.
it works. Even with severe OA, problem.
See,
Yeah.
the OA issue is not going to solve because it's already happened.
Yeah, mate.
OA issue we can't do anything because that already happened. But this will make it not become worse. It will stop the OA issue. Whatever she's having now, it will stop there. But this will elevate the rest of the problem because it's not only OA. She might have low back pain as well because of the improper posture. But the thing is, they need to wear it at home. If they don't wear it because that's where they spend most of the time. Like for my mom, I can't do anything. She refused.
Can you use it in the gym?
You're supposed to use because you go for your walk, you go in for your jog, but don't straight away put a jog because you need to get it acclimatized first. So I suggest you go for your walk, your gym, your work, use it as much as possible. Only place that you come back home, you don't use it, it's okay. Because very few hours you spend at home because most of them are council. So whenever you are out there, you're working, try, the more you use, the better it is. It's like that. You go for shopping, you will see the difference. Last time you go for one round, you're already tired, now you can go 2 rounds of shopping. That's how it works. Alright, okay, let's adjourn for our tea break. Then we come back again.
Elderly patient, most of them, they don't want to go for operation. So I said, you try this.
But the thing is, it will not elevate the pain, but it will stop the progression. Progression will stop, that's it. Come.
Patient here multiple times because of the
Okay.
then the
Because of that, pressure on the front.
Melaka Maripan.
this certainly helps.
Yes.
I think you're my pet.
Very
Yeah.
Okay, everybody's here. Have a seat. Everybody's here, right? Dr. Thomas. That's the speaker. Alright, welcome back. We're coming to our second module of the training. Alright, so now I'm going to show you all how to do the footprint, practical session, how to do the footprint, and then module 3 will go out and analyze. Now we just do the footprint. So I will just show for one person. Then it's best that you all do for each other. So you know actually have a hands-on how it is done. So anything I can correct as well. So you learn. The more you do, the more it's very easy, but sometimes you get confused with the direction of the slides and everything. That's all. Alright? So next, first thing first, you need to have we will provide you the template in a soft copy. Okay, this is what Dr. Siva uses in his clinic. Alright? So where you can actually change your name of the clinic, you put your doctor's name or your logo, whatever I will give you the word format. Why this is important, I'll explain it as well. Alright? So just pass it around just for everybody to see. Okay, this page is very important. You know why? If you look at it, there is a measurement here. There's a line there. That measures about 200 mm, 20 cm. Alright? Why that measurement is there is when you scan, that's why we want you to use this template for all your footprints. Don't use your normal, although it's A4 size paper, use this template to do the footprint, because when you scan and send it to me, send it to us, when I scan, I will print it out, I will measure whether it's coinciding with 20 mm or not. If it's not coinciding with 20 mm, that's not actual size. Then I can't do the sizing for you. That's why sometimes when you send, I tell them, no, you need to scan back to the actual size. If you scan and send me the size runs off, the size I'm going to give you is going to be wrong. So that's very important to use this template to do the footprint. So when you scan and send it to us, it's easier for us to do the sizing. Alright? So we use this paper to do the footprint. Alright? So if you look at it, on the top part, all the details you need is the client's name, alright, age, male or female, and then the date of the footprint taken, alright, and then rough size of the current shoes you are wearing. Alright, if you look at it. So this one just to have why we need male and female, what client's name you need, male and female, you know, so that you know whether you take the size W or the N is for female, W is for male, alright? And then the shoe size roughly to know, because let's say your shoe size is 10, it doesn't mean that the size is going to be 10. It differs, so it does not follow your shoe size. Don't get under the impression, I get the shoe size, maybe you got the shoe size 10 here, you know roughly to take size 11 or 12 to do the sizing. When you do the sizing, you'll understand better. So always use this template that we've given to you. You can change your clinic logo, whatever name you want to put, you can put. And then we use this for all the footprints. So why I told you the 200 mm is very important for us to do the sizing when you scan. Unless you're doing the sizing in your clinic, then it's not necessary. You can even do it in your A4 size paper and do the sizing, because you're not scanning and sending to us. I don't need to have a comparison. But if you want us to do the sizing, you have to use the template for us to do the sizing. Understood?
So you'll be sending the template to us, lah?
Yes, I'll send it to you in a Word format so you can adjust, put your logo and everything, so that sometimes it's nice, even though the patient don't buy, you can give them a copy. Tell them these are the issues. Sometimes most of them, they go back home, yeah, I have this, they come back and say, I want to buy. So at least your clinic name is there, so they know where to come back home. Or when they show other people, they are actually doing some indirect marketing also for your clinic. Alright? Okay? So, first thing first, this is the sheet. What are the information we need to take? That's one thing there. Second, this is the print board. Alright, print board. Okay? There's a smooth surface here. Smooth surface, this is where you step your foot. People think we put ink, step on the ink. They are worried the ink will step on your leg. No. This is where you put it. The rough surface, this is where you put the ink. Alright? And then this is where you step. So these are the thing. So this is called the roller. This is where you put the ink and then roll on the rough surface. Alright? So very simple. First thing first, you need to put the ink. roll it out so that you are inking the surface. Alright, so this is how you ink the surface. Very simple. Just evenly do it in the slow motion. So once you evenly ink already, that's enough. This paper, alright. We place it here, and I'll show you again in the closer look. There's 3 dots here. You put it this side, close it. Alright, once you put it here, you close it, it comes like this. You put it on the floor, patient step 1 feet, and then you turn it over, strip the paper, step on the other side. Then you get the print already. Very simple, correct?
So
Okay.
we won't be painting the food with any ink.
Your food will not touch a single ink.
No, I was thinking about this.
No.
Use this and paint the food.
That's what people are thinking. Oh, you're going to make it very dirty. Okay. Your food is not going to be dirty at all.
Okay.
Alright.
It's just like carbon paper.
Okay.
Yeah.
So now, let's do a demo. First, can I have a pen? Oh, pencil. Okay. Link, right? Okay. Can you come forward? You are the model today. What's the spelling?
L-I-N-G.
L-I-N-G. Okay. How old are you now? 18.
18.
Okay. Male today is 30126. What's your rough shoe size? Okay, roughly 11. Okay. So now, Raja, can you bring the camera
Okay.
up?
Oh, camera.
You bring the camera with you.
Okay.
So you need to
Be the
hold it.
cameraman.
It doesn't matter. Just hold only.
Okay.
You take a 360 with you. Okay. All of you all come here. Come forward. You all stand that side. All stand that side.
Okay.
Raja, you can stand there.
Okay. There's no
No need to worry.
auto.
Recording is auto.
Okay, cantik.
So now, as I said, I've ordered put his name, his age, male, date, and the rough size. Okay, so that's all we need. We don't have to. Sometimes people will say, "I'm having this." Don't take the comment first, because you want to tell them before they tell you. That's where the impression is. Correct? I'm just first time seeing him as well. Alright? So now, again I said, so they don't put the ink here. That's why normally when we give the board, we ink for the board for you, so that you don't wrongly ink the other side. Because there have been certain instances, we send a raw board, people won't apply the ink here, that's it, gone. You can't use the board anymore. So now, that's why I said that before we set the board, we ink the board for you, so that you know where to put the ink. Okay? So again, you already put the ink ready. Just roll it. Okay? Okay? Okay, done. Can you see the 3 dots here? Can you see the 3 dots? Yes. Same in line on the top line here. Put it here, touching the 3 dots. This one you align with the same line with the same dot. Okay? Done. You close it. Okay? Always where the name is facing you. So always remember that. This part is facing you. Alright? The patient must be the opposite. Link, come here and stand here. Raja, you can come closer so you can keep. Okay. So now, very simple. Normally we let the patient have something to hold and stand as well. Okay? So that sometimes they get imbalance. First thing, always keep the board partially closed this side. This is your left hand. Okay, Link, your right leg you put here in center. Okay. Now, your left foot center of the board. Center of the board. Okay, step. Okay. Put your hands down. Look straight. Look straight. Okay. Can you take it out? Okay. One foot is done. So you didn't go too much center. That's why it doesn't matter. Still okay. Still using the paper. Now you need to re-ink it again because the ink is already absorbed for the 1 foot, correct? So you re-ink again. Done. turn the patient paper, turn up. Always remember the wordings towards me, towards you. Again, same 3 dots, same line. Okay, done. Now this is your right hand. Left leg in the center. Right leg, left foot on the center of the ball. Okay. No. Okay. Okay. Step. Look straight. Put your hands down. Hands down. Look straight.
It doesn't matter if you don't get
No, it's not. Okay.
because
Okay.
the measurement,
Yeah.
the measurement is only the
So done. So both the print is done. You see, this is left leg, this is right leg. See, it's not same shape. Can you see the difference? Alright. Okay.
the heels.
Analysis wise, we will do it together afterwards. Okay, next, who wants to try? I want all of you all to do for each other, so all will get a chance to do it. Alright? I will observe. This is the board. This is the ruler. I think already ink is enough already. Okay, so you no need to ink again. Already put enough ink. So these are the papers. So who's doing next for whom? Please side. Okay. Okay. Who's doing? Vanessa. Okay, Vanessa. Okay. Spelling.
See, I brought my board also.
The time for you lah. Write
No,
your name.
we can use my board also. Just brought.
No. Just use
Oh,
this
this
one.
one.
Okay, no.
They teach me how to put the ink.
You want to see really come and do it.
Okay. There's a click there. Okay. Open it. Put the ink. Just roll it continuously. What do you do? You need to do in this motion. Let me say, you're doing that.
Use one paper, one
Oh, this way.
Yes, continuously. No, you can do it any way, but this is the motion you need to use. Press a bit and then so that it gets ink properly. That's how you must use it.
Too fast.
Okay, that's good, enough. Okay, enough.
Just take the size of it.
Okay, now put the paper.
However, align also, the toes will always end up on top.
Two dots.
Okay, same line. Okay,
Oh, which is the right?
One foot, one
Then
paper.
you can see this
1,
dot.
2, 3.
Oh, this.
Yeah.
1, 2, 3, 4, 5.
Yep. That's touching is just enough. Yeah. Don't know it be perfect, but that's the indicator. Okay, proceed. Name towards you.
Left leg.
Always
Your
Close the
right.
body.
close it partially so that they don't accidentally step here first.
Okay.
Alright, that's why you always close like this.
Okay.
Okay, now this is your left. So
Yeah.
right foot.
Right foot here. Yeah?
Yes.
Okay.
Oh, sorry. Okay, left foot center of the board. Okay, step. No, it's okay. One step, just leave it, doesn't matter. Okay, look straight. Okay, done. Open it. Yep. Now put the ink again. Need to.
Very clear. This one really perfect.
No, I didn't use my last two.
Oh, last two we see. Almost perfect.
Close it. Yes. Yep. Yep. Okay, center of the board. Okay, step. It's okay. Once you step, don't move because then you'll have a double print. Even though it's a bit run off, it's okay. We can still do it. Alright, done. Okay. Okay, see, done. Simple. Okay, so Vanessa, you can do for Dr. Mani. So we do the analysis at the end.
Has to look up,
No, look straight.
not look up.
No.
Oh, because that day the video
No,
has to look up.
No, straight. You look straight. Means you are balancing your body straight. look up, then again you are stretching already. But doesn't affect much.
Does that affect much?
Yes,
I look straight now.
straight. Write the details first. Ready? Finish? Run? Okay, right. Okay. Have you put the ink?
Surface flat, not
Okay.
not flat, doesn't matter.
Pardon?
The surface actually is a bit.
No, that doesn't matter. That
This
doesn't
one is
matter. Yes.
Oh.
Eh,
Dr. Mari itu.
Okay.
Oh ya. Terima kasih.
Okay.
Welcome.
Okay. Now. Okay. Look straight. Yes. Okay. Done.
Tu,
Okay.
semua pun ada. Ini macam tak boleh jual ni.
Press a bit. No, you need to see. Can you see the? You can see the dryness there. Yeah. So that you have a proper print. Yes. Correct. Yes.
boat, the wear and tear for this boat, the replacement.
Pardon?
Wear and tear, like this thing come out.
No.
So far, we don't have issues yet. But if you have that, you need to buy a new bottle. Depends on the usage as well.
It's okay.
Pardon?
I think should.
The other side. See. Yes, you need to see because you are taking the print here. So this one must be there. Okay. No. Turn this way. Always the writing towards you. That's the indicator. The writing must be towards. No. Now you move bit the side a bit. Then some more. Okay, now your no. This take here.
Right here, left hand.
No. This one
Left must come here. Oh, okay.
Yes.
Come here.
Some area some more and center some more. Okay, yes. Okay, now center of the board. Yes.
Okay, that's it.
Yep. Okay, take out. So always remember the wordings towards you. That's how you can get it done. Okay, done. Okay, this is done. Okay, next. Okay.
You have careless and things.
Shoe size berapa?
6.5.
I never did it.
Later, I'll
Yes.
explain.
Analysis we'll do later. Now we do the footprint first.
Kita boleh belajar banyak benda boleh lah. Biarlah.
Ibu memang garang.
Mesti
Ha.
like batik.
Ha.
Okay,
Okay, cukup.
dia sama dengan ni.
Yes, correct. Yep, correct.
Allah. Jadi.
Look at the Okay. Alright. And then always remember wordings towards you. Correct, betul.
Tutup separuh.
Tutup separuh. Okay, center of the center. Okay, now center of the board.
Sini.
Yeah, betul.
Just relax.
Relax, look straight. Okay, done. Okay. Okay. Okay, betul. Now put the ink back. Okay. No need to go too much to the edge. Just the center cukup. That means you're going too much to the edge. Okay. Alright. Okay. Tepat.
Okay, that's another thing we have to remember. Okay, tak apa.
Okay.
Yeah, someone.
Yep. Okay. Alright.
I'm doing with him.
Okay, ada sense ni.
Nice and slick.
Okay.
Dah kan?
Okay, dah.
Forgot to ask him just now.
Flat seat.
By wearing the pants,
Yeah.
now we have done this pressure, right?
Correct.
Maybe after a year,
Uh-huh.
maybe just say after using orthotics we are doing again.
Okay.
Will we see a difference in our?
For 2 to 3 years, they see a difference.
They see a
your
difference.
shape changing.
But they don't have to change the
No, because the
Because the
insole,
insole will automatically take.
the insole will mold with your
Full
foot.
itself, yeah. Okay. Okay, but so about 2 to 3 years we can see the changes.
Yes. But you need to continuously wear. You after 2 3 years, okay, a bit changes. You want to change, then cannot.
Continuously, like Asians rarely wear shoes in the house. That means
No, if you, let's say it depends on how much you time spend in the house. You spend more time in the house, then you wear it in the house. You spend more outside, then wear outside. You come for a while in the house, you're going to eat and you're going to sleep. There's nothing.
like this.
Ah.
We wear shoes as when we sit really practically not like you say we have to wear and walk.
Correct.
So how would it benefit us just wearing and sitting down?
Because see, even though you walk a few steps, you're walking in a proper few steps.
Okay.
Understand? No?
Okay.
You're walking to the car, although it's just 100 meters away, but still you're walking with a proper few steps.
So you still get the
Yes.
effect of the
Yes, correct. And then let's say you're going for shopping, you go for a wedding, you just wear and go.
Yeah.
You understand? No?
Shopping, yes.
Yes.
Driving and all.
So kanan.
Yeah.
I mean, inside the clinic also you have to get up.
Yes,
Sometimes I
correct.
go to nurse station, go 100
Correct.
times to there.
That's
Okay. 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 Dah.
Can wear.
Pardon?
Pregnant also can wear.
Can because again you're not doing any harm for you're correcting the posture. Actually, they feel better actually because of the weight bearing on the stomach and everything. The backache is already pushing it. All right. So actually, it will actually give a beneficial effect as well.
Marketing this
Huh?
one. Those who come and very bad, very
Correct. Because it's correcting the posture only. No harm.
Definitely, like you say, there'll be an aspect of it because
Correct.
of the weight bearing.
Correct.
Huh?
Yes.
I never thought of it that way.
I thought of it, I was thinking, they advise not to go for reflexology if you have pregnancy.
So because this one is correcting a position, it will elevate their back issues, their knee and ankle pain.
Then they can use the same one after delivery.
Yes, correct. They don't need to change because they
The
we
food
do the
is
same
still the
thing.
same one.
Yes, food is still the same.
Because the weight will be different, right?
Yes. You hold the table easier for you to balance.
Okay.
Okay, done.
Okay.
Okay, done. All right.
Semua ada.
Okay, next. Who's doing?
I'll write that. You want to put?
Hmm.
Okay, you write another bit. I'll take it.
So now left Suraj only, isn't it? Suraj and Chong. Is it? Both of you all. Come.
Yeah.
Oh, sorry.
Out of it. It's outside the circle.
Okay, after the circle. Okay. Now is left hand side.
Okay. This take the energy.
How frequent you
Hey, sorry.
clean?
That's not
How
left.
frequent you clean?
No, once now I only put one, so enough already. So let's say you're using it on a daily basis, then it will be there.
Yeah, I mean,
You are doing it 2-3 days, you don't do it, it dries off. Then you need to put it again.
I think it's just the side lah. Okay lah. See how it gets. Okay lah. Okay lah.
Oh, okay.
Overlap.
Okay. That's okay. Sometimes the field is too big. You can do one per page or so. You don't need to worry. Yes. So wide. You don't need to worry about. Yeah. So you can use one sheet for one leg also again.
Tak cakap tadi. Tak tahu boleh tutup.
Okay, first one is
Cross sikit.
Okay, first is left, right,
No, left leg.
sorry, left.
So right leg will come here first.
Yes. Partially close the board. Partially close the board. Okay. Okay. Now.
Good. Come up a bit.
Come on.
Come on.
Okay.
Your leg also big like you.
Okay.
Okay.
All right. No. Okay.
Okay.
Okay. Now center of the board.
Okay. Okay. Done. Okay.
Step.
Okay. Okay. Okay.
Okay.
Then.
Look straight.
Press the toes down.
No.
Okay.
They put according to their body weight pressure.
All my toes cannot see you.
Using toes.
Okay.
Ada.
Oh, nice.
Okay.
Okay. So next one is this way.
Oh kan tak.
Besar 200.
Dia macam
Size 11.
dia tu macam sama. Dari
Facing you.
Okay.
Okay, so this leg will come here first.
Okay.
Okay.
Oh.
Okay, yeah?
No, in the middle.
Like this.
Okay, correct. Okay, nice. Okay.
Can I?
Okay. Okay. Okay.
I think
கொஞ்சம் overlap.
Overlap already, yeah. Okay, yeah?
Okay.
Yeah, I think overlap.
Overlap a bit lah. Overlap.
Alright. It's okay. It's okay. It's good to do mistakes so that we can learn. Yep.
Is the 26.
Will spine instrumentation change any of the? Like you see, I've got 2 rods and 13 screws after
Okay.
spinal fracture.
Alright.
Okay. Will it change my?
Because why? See now, I will tell you what is this is with your spine issues, with spine correction. All right. So now, what are the issues there? How to address that? You understand what I'm trying to say?
Okay, so that means
Yeah.
we can still improve lah.
Yes. Correct.
Yeah. Okay. Do one more for you. No, just drop the overlap. This one, which is
Ah. Okay. Okay. Now can okay. Okay. No. Correct. It's correct.
Oh, already in here.
Okay. Come on. Open. See now. Okay. Now you open up this one. You need to click it. If not, the thing will come up. Okay. So now you do. Okay. Now ink it.
Good for both things.
You don't need to go to the edge because you get stuck. So you just put on the center side. You put enough.
1 foot, 1 paper.
Yeah.
1 foot, 1 paper easier.
Okay. So that's done. So now easy way is can you see the loop here, the hole here? Take this and then position the paper. Okay. Just take out your hand. Just drop it.
Okay.
You don't have to close the whole thing. There's a loop here. Take, put it up and put it up. So I didn't tell you that I see anybody that is doing it or not. So it's good to learn from mistakes. That's why I'm telling you the now the proper thing. Okay. Okay. Proceed.
Okay. You're going to stand here or?
She's doing it. You're doing it, right?
Yeah.
He must do lah.
You're doing for her. Yes. So you need to turn. Name us towards you. Okay. So come closer to the table. Suraj, come closer to the so that she can hold a bit. Okay, one leg there. Okay, another one center of the board.
Wait. Jangan letak dulu.
Okay. Just look straight. Okay, done. Yep.
Okay.
Just don't go with the best to do is this way now. Press with the side pressure. Just don't go too much to the edge. That way.
Press it.
Yeah, press slight pressure and then just go that motion, yes. So you can ink it better. Okay, done.
This one, you drop the ink on this, is it?
Yes.
Okay, that means the stamped ink, we just drop it on top of this.
Yes.
Huh?
I showed பார்த்தீங்களா முதல்ல பார்க்கலையா? Okay, I'll show you later. Okay.
Yeah, no, they're coming.
Okay.
So
Alright.
I'll go back and do for my son.
Alright.
I think want to adjust like that for him is difficult.
Yeah.
Quite a bit also.
Hmm?
Put the ink quite a bit.
Just put lightly.
Okay, done. Step. Okay.
Print on the
Okay.
Oh.
Okay.
Okay.
Alright, done.
Same like come for this today.
Okay. Now for swatch. No, you need to lock it. Then. Yes.
No, all the way down.
Yeah. You don't need to go too much to the edge, just the center is good enough. Okay, enough. Should be okay. Okay, now place the paper. It's okay, you don't need to close because you're going to put it again. Just put it that way so that you can do it for the next leg.
Inking each, I mean, every time we do have to ink it for each.
If let's say now you're doing it, like now, I only put the ink at the beginning. Just now only, that's it. I didn't put after that. We are still using the ink because it's still it's not dry.
Lasts quite long.
Yes, actually it lasts for quite long if you're continuously doing it, because you leave it for a while with the aircon, now it dries up. Then you need to, let's say you're not doing it for a day or two, then you need to put the ink again. But don't put too much. Don't put too much.
You're going to get everyday patient.
Correct. So that's how it is now. You just put one day, you can do the whole day already. I'm telling you, you don't need, even though there's no backache, you just do like a general screening. Let's do a print. Okay, you might have these issues. Most of them will say yes, I'm having this issue.
If the person has come a few times for backache, just do one. After that, we decide whether we want to buy or not.
No, you can actually package this along with your blood test.
Yeah.
What pharmacies don't have, we have. That's why we need to do it. We need to be creative.
Right.
Okay, I charge you the same, but I'm doing footprint. Pharmacy cannot do it for you.
Correct.
Correct or not?
Correct.
No, into the next one.
Correct.
No.
Your cost is only for the bot one time, and then the ink is very cheap.
Yeah. I put for them. People come and do.
Yes, yes.
Not everybody wants to do stuff, right? When
Correct.
they see, then they say, okay, but I charge for the footprint. lah.
Footprint, yes. You can just include it along with your blood test and do it as a couple.
Now I'm thinking how.
Because everybody wants to be creative, doing new things.
50.
Yeah, 50.
They're okay with it.
Siva say 50 to 80 you can put also.
Just put only, bro. Don't do it for free.
But when they buy, you minus the $50 from them.
Ah.
No, I put only. I
Yes, sir.
separate.
Sigama
Value,
different.
value,
Yeah,
bro.
yeah.
Yeah. You have to sell yourself.
No, but plus you're also analyzing and interpreting the results.
Analyzing,
What? Correct.
See, today you already go come here already. You have to put locum income, you know. So you have to collect back, what? Alasan lah.
Okay. Center of the board. Okay. Alright. Okay, done?
Ah, you tak pakai stokin. Alhamdulillah.
Okay. Alright.
I pun tak pakai stocking.
Okay.
Kau tak pakai juga.
Okay. So everybody is done?
Then,
All done, okay.
All done? Okay, good.
so that's why my slipper will house, I mean, it eat up one side.
Yeah, mine also. My shoes will take on one
You
side.
can see the pressure. Spanish.
This is good. Sorry.
Everybody in the house. Little empty. Everybody
So this is the place we put the food lah. This other side.
Okay, now you have done the footprint. Okay,
Here.
let's go for the how to assess your limb length difference. How you also, I think you all need to come back here again.
Okay. No.
Okay, come back here again. Come to do the demo. How to assess your limb length. Very simple method of doing limb length difference. Let me take this chair. Okay. You get Mr. Ling, our model here today. Lucky she brought the camera. Now, get the patient to sit all the way back. All the way back straight. Okay. Put your knees closer together. Yeah. Sit back for more. Okay. Close. No. like that and close together. Okay. Take a you get a ruler at home. You look from the side here. Come all everybody come this side. Okay. Raja, can you hold the camera also?
Okay, wait. Sekejap. Okay.
Okay. Be there. Be that side. So you can. No, you go that side as well. Doesn't matter.
I'll go this side. So.
You go that side.
Sorry.
I only want to see from your side. Visually, you can see as well, right? Any side you are looking at, you can see one is jetting out, one is not.
Left.
That means he's already failed, not same. Correct? I'm not doing any magic. Very simple technique to see whether your left and right leg are the same. You can see visually as well. Alright?
The knee is jutting out, is it?
Yes,
Oh,
yes.
So the left is longer.
Left is longer.
Longer.
Okay, okay, now it's okay.
Okay.
No,
Alright?
just now it was hitting his leg.
Okay. Okay, now another thing, to like a ruler or any straight line object, just put it here. You can see the difference. Can you see?
There's a gap.
Can you see the difference? So that's the easiest method to demo. Your left and right leg is not the same length.
So which the gap one is shorter?
Shorter one.
We cannot assess like that
Oh.
because don't think that
Oh.
the one jetting out is longer.
So
It's not
there-
necessary.
Oh.
It's just to say there is.
There is.
Okay.
You want a measurement, then you have scientific measurement. We don't need to spend much. Don't waste time on doing that because this is already clear cut.
No, but
Okay.
like what you said, like more than 2 cm, you shouldn't.
No need because more than 2 cm you will see obvious
Limping.
limping. You don't have to because we are rocking. You don't see much. More than 2 cm, you're already seeing people are obviously
Already
limping. That's why they need more normal walking. No need to worry. Okay. Okay. Link done. Okay. Money sit.
Both sides.
ஆமா bro. நான் இப்பதான் பார்க்கறேன்.
Maybe you need to lower the chair.
எனக்கும் long shot லாம் இருக்குமே.
Yes, correct. So that your foot is touching the ground. Are you sitting all the way back?
Yeah.
Okay. Okay. Straight. Can you see from sideways? Can you see? Okay. If you can't see visually like that, yes.
Right hand side
Again,
is
you
lower.
see.
High.
Can you see?
Same.
Alright. So this is how you can demo to the patient. Your left and right leg is not the same length.
But you
Because-
can't say which is long, which is short.
Yes, we cannot do assessment by like that. Alright? So, understood?
Yes.
It's a very simple method where you can demo to patient because patient need to see themselves or the relative need to see themselves. Hey, yeah, lah, my left and right leg is not the same. That's could be the cause. So this is the easiest way to demo your limb length difference. Understood? Anybody want to see? Maybe Vanessa want to see? Maybe we'll have a female patient to see. You see all the way back. All the way back.
Tak
Okay,
ni
maybe
semua orang bunuh dah. Itu.
you use the board.
Semua orang pada
This one, hers is this side.
That's it.
This side. Maybe we can do a study, maybe females will have this side already.
So, okay, I
Huh?
attack.
You will see whether it's same or not.
That's the
Okay, maybe you want to lower the chair a bit because you don't know, you need to,
LHD.
your foot
I think
everything.
this is the lowest.
Yes, is that the lowest?
Step back from
I think I can go, I think.
1000.
No.
Okay, that's the lowest, okay. Come on, go all the way back.
யானை இது பார்க்க போனால் மெடிக்கல் ஆர்த்தோட்டிக்ஸ் தான்
Go unit, okay.
கிளினிக்லேயும் பேசிக் கிடைச்சா போதும்னா
Oh, yes.
Yours is the side. So
Left
they
side.
statistically cannot be able to can't do study.
Everybody on the left hand side is a bit.
Okay, so that's how you demo to your patient. Okay, so they need to see themselves so they have to understand.
My right hand side.
Very simple method. There are
Everybody
so many scientific measurements and radiological things are there, not necessary. Very
Rough
simple,
method,
rough
yeah.
method. Got it? Let them sit all the way back, and you can see the difference on sideways. All right? Okay, now you all can go back and sit.
Jauh.
Okay, any questions on limb length difference?
No ma'am so far we will come.
All clear?
Mana dah?
Okay.
Oh, cepat.
Dah tak nak.
Okay, now
I
I will give back to. Okay, now we do one by one. Okay, this is Suraj's one. Okay, look at this. Now just look at only the shape. All right, don't look at the pressure point now. Look at this diagram. Where do you think I'll number it 1, 2, 3, 4, 5, 6.
Mm-hmm.
Which number he falls? This we can actually pass it around as well.
Both you must evaluate both the.
Yes.
Okay.
Five.
5.
5. Okay. Some more.
5 and
Maybe high arch, 3.
Slightly flat foot.
Oh,
2.
I think it's 3.
3.
Yeah, can also.
Okay. 5, 3. Some more. 4.
5 and 3.
Okay. We have all the numbers. Okay. That is simplified. Okay. Just go for the shape first. Alright. No way is the number 1.
no.
You agree with me?
Right.
Okay. So it's either from all these things. Okay. You always compare with the perfect first. Alright? Always look at this curve and this curve first. Alright? First of all, another thing you must do, whether all the toes are seen. The moment all the toes are not seen, you know, it doesn't follow the perfect already. That's one thing. Alright? Now let's go for this curve first. Do you think he has that curve? No. That means he's falling into this condition.
Okay.
Alright? Do you think he has the inner curve?
Not much. The left one not.
Is it?
Left one
Alright? He has.
Okay.
But is that much curve?
no.
It's not. When it means he's also using the outer margin. That's he's coming towards the fat. Not completely fat, but towards the fat. So his issues is he has some amount of flat foot, some amount of supination. Alright? So those are the obvious things that he has. Alright? Okay, next we go to Chong. Okay? You look at Chong, it's almost similar to Suraj as well. You agree with me?
Yes.
Almost similar. Okay? Flat, going towards flat and going towards supination as well.
And more
Alright.
pressure on the heel.
Yeah, pressure will go for the next one. Okay, I'm just now we just discuss on the topic of the shape. Okay, now this is Raja Kohila. Alright? Again,
Flat.
almost same.
Right. Yeah.
There's some amount of supination, some flat foot as well.
Yes.
Alright? Agree?
Okay.
Now comes to Luis.
Luis.
Again, almost the same. Supination and flat as well. Correct? Okay?
So is that the most common, doctor?
Yes, mostly common is flat
Always common,
and
yes.
supination is common. Alright?
That's
This is Azlini. Alright. Dr. Azlini, her shape is not bad. Alright? She is almost coming to the perfect arch, but not. Okay? You see, okay, let's look at this first. She has some amount, but again, she's supinating as well. Alright?
Became flat.
Her inner curve is okay, not so bad, but she's supinating. Okay? And then the little toe is missing
Yes.
on the left. That means her arch is not proper. Okay? Understood? Okay.
E.
Now this is
This is
This is
typical flat foot
Yes,
person.
yes, that's
If
it.
you take my foot, it looks like this also.
That's it. Yes.
Alright? This is typical flat foot person. Alright? This is very typical of flat foot and supination as well. So this is a very classical example of flat foot and along with the supination. Okay? Come to money. Almost same like Suraj and Luis and Chong. Alright? Flat as well as supination. Okay? Coming to Dr. Vanessa. For her, she's going towards high arch and supination. Do you agree with me?
No.
Alright, she's coming towards this and this. Hers not about that. Hers is more on going towards the high arch and then supination as well.
The high arch means you shouldn't see the center part. Is it? Oh,
Going towards.
towards. Like.
Towards.
I mean, the real high arch, the center won't be there.
Won't be there.
Oh.
So some will be very thin as well here. Alright? So again, supination as well is there. the toes are missing. Alright, so again, the arch is not there. Okay, coming to Ling, almost following the mother. Okay,
Yes,
and then
flat
you
foot
see,
also,
if
right?
you look at the left and right leg, it's not the same. His left leg is more flat compared to the right. This
Yes,
is the left leg.
yes,
This
yes.
is the right leg. So this is his left leg is completely flat, almost completely flat compared to the right leg. Alright? Another reason is because of the limb length difference as well. You understand? No? That one leg becomes more flatter than the other one. Okay? Okay, now this is on the shape. Any question on the shape? So this is how you want to go to. I will share with you the slides. I share with you the diagram. So you have to learn, read more on that. So you can explain to the patient. What are the shapes? Why your arch is not proper? Why your shape has shifted and everything? Okay. Okay. Next, come to the pressure points. Okay. Come. We start the link. Okay. Look. Where do you think? Okay. I'll go for 1, 2, 3, 4, 5. Okay. Is definitely link is not on the first one. Correct?
Second.
Okay. He has very obvious second.
Yes.
Okay. So is very prone for developing low back pain. Are you having or do you have frequently or something?
Well, I will lift heavy stuff.
Pardon?
Lift heavy stuff.
Okay. That's the thing. So lifting heavy stuff is the trigger. Although it's not 40, because of this, lifting heavy stuff triggers the pain and is having the pain. Now you understand? Alright, although he's only 18 years old, he's having the pain because you see his left leg is completely flat. Correct? And then you saw the limb length difference as well. And he's tall, he will have more issues because balancing the muscles in the top because he's tall. Alright? Okay? So what else you can see?
A bit on the
Okay?
transverse arch.
He's also putting some amount of pressure at the front of the foot. So he's also prone for neck, shoulder, and headache as well. Any such issues you have?
Shoulder.
Yes. See? Magic. I've become Bomo already. I don't know him. First time seeing him. I don't know his medical history, correct? Even Chong forgot I have a classmate. Okay? So, this is how you tell your patients, yeah, I have this, I have this. All these issues that he's having will be corrected once he starts using the techniques. Because the imbalance is corrected. You don't need to go for painkillers and do blah 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 things. Got it? Understood? Any questions from that? Clear? Alright. Okay, next, Naresa. Where do you think she's falling?
Heel.
Okay. So again, heel pressure, front of the foot, prone for low back pain, shoulder, neck. Do you have such problem yet? Not yet. Because not 40 yet. So you are very prone. Alright? If you don't take care now, when years comes by, you are very prone for low back pain and neck, shoulder. Alright? So this is what it tells. Okay? So once you get the trigger factor involved, then the pain comes. Because you're not caught the trigger factor yet. Alright? Okay.
Must we do exercise?
Okay, yes. So as I say, sometimes you balance everything, you might not never get it as well. Alright? Okay, money. Again, you see the pressure. Okay.
Toe.
Do you have a bunion forming anything?
Not much.
Corn?
No.
No corn?
No one.
Any hard?
But this
skin?
heart, yes, definitely.
Hard skin?
Yeah.
Callus.
You're going to get corn here coming up.
Ah, yeah.
On the way.
Yes.
On the way. Alright? Corn is coming on the way. So these are the indication that the corn is on the way. Alright? The only way to stop it is start using the orthotics. Alright, again, pressure on the heel, pressure on the front of the foot. Again, he's prone for low back pain, shoulder and neck. Do you have such issues?
Yes.
Yeah, so because it's already the 40 years already, so you have the triggers and the wear and tear. Alright?
Okay, front of the foot pressure most like is a problem in the arch.
See how? They're very useful. Heel, more pressure on the heel, hip and below issues. Pressure on the front of the foot, hip and above issues. That's how it
Correlates.
correlates. Alright? So what I'm talking about hip and below, you're talking about including knee and ankle. Alright? You'll be very prone because once your alignment goes on, you'll have ankle, knee and back
The
affected.
the front pressure is a problem with the transverse arch.
Yes, transverse arch. Alright? Okay. Now come to nose, Suryana.
Very flat.
Imported from Australia, I thought.
Yeah.
Okay? Look at it. More on the heel.
Heel.
It's very prone for low back pain as well. Do you have anyone? Not yet? No?
Sometimes.
Sometimes. So again, it's because of the flat footness. And then the pressure, more pressure on the heel that causes you the low back pain. And also can have knee and ankle as well. Alright? Okay, next is Azlini. Dr. Azlini, same
Heel.
front and pressure
Yes.
the back. So
And also in the
Front.
yes, front as well. So again, low back pain, shoulder, neck.
Yes.
Yes?
Sebab above 40.
Yes. So again, these are the things that the footprint tells you. Alright? Even the corn is developing, you can see. Alright? Okay, next is Louis. Similar problem, front and heel as well. Low back pain, shoulder, neck. These are the common problems we see actually anyway. Alright? This, do you have anything there? Coming up?
Thickening.
Corn is on the way. Congratulations. It's because too much pressure on the front of the foot. So if you don't elevate, the corn will start developing. That's what it shows here. Sometimes you can see multiple points. People start having corns. Those people, those who you see those prints that you see lot of pressure in the front. This is still okay. You can see really dark pressures there. They will have sometimes multiple points of corn developing on the footprint. You can see. Alright. Raja, similar issue as well. Alright. Are you having a corn as well? Hard skin.
My foot is skin is dry and thicker,
Dry.
but no corns.
On the way.
But it's overlapping.
Because it's overlapping, I'm not sure whether it's right or left.
Yeah.
One of it has.
Oh,
Maybe
okay.
you have a board, right? You can do.
I'll try to again.
Do because you have a broad fit. So
One
page is.
Okay.
So you see which foot shows the hard skin.
Okay.
Then you know which foot has
Higher tendency for corn.
yes, corn, yes. Alright. Again, low back pain, shoulder, neck. Alright. Okay, Raja asked me a question because he has some surgical he has metals in the spine and everything, screws and metals. So this is your current situation with all those corrections, but still not corrected because the spine is not the issue. The issue is your limb length
Okay.
and the arch. So you correct that arch, even though you don't, your whatever backache or shoulder pain you have, all that will be elevated.
Improve.
You have a better quality of life, actually. Right? Maybe because of the spine issue, you are not exercising. You actually can start exercising, go for your walk and everything, and you will feel less tired. Because that foot very fast you get tired when you walk. Correct me if I'm wrong.
yes.
But I'm same like you. After this, I go shopping. Everything is easier for me. I don't get tired walking a lot. Alright? Okay, now coming to Chong. Similar issue as well. Alright? Heel, because is more on the right leg than the left. Sometimes you can see that as well. So again, prone to low back pain, shoulder, neck.
Yes.
Again, not because anything else. It's not a big science. This has been there for since 1974. 51, 52 years. But we are only now discovering all these things in Malaysia or Asian countries. Alright? So, any questions?
Dr. Ben,
Yeah.
do I have a white sole? Do I need to use the men's one?
No, not necessary.
Oh.
Not necessary because there is so far you only have one female patient male size
Oh,
because hers is very wide.
Okay.
There's another way to see whether that whiteness can cover or not. I'll teach you this when we do the sizing. Alright? So we can see whether you want to use the white. That patient was really white, so I have to give the male size. Some female patient, they have issues, and I have male patient as well. The foot is so small, there's no size for the male. You give him the female size. It's okay. So sometimes you have to adjust recording. Sometimes some people fall into different categories. You can actually interchange and use. That's not an issue. All right. Coming to Suraj, it's not so bad. Not so bad. The print is almost equally distributed, but some amount of darkening on the heel side. So there is a tendency for low back pain. Alright? So yours has a tendency of low back pain as well. Because the arch is already out of shape, already on the flat foot, and then some amount of darkening on the heel, so you are prone to low back pain as well. Alright? So this is how you analyze and you tell the patients. So far you see that we are among 8 in front. So this is the module 3. Alright, module 3 we are going to teach you how to do the sizing. Analysis we have done. Now I'm going to tell you how to do the sizing and how to show the patient how to wear it in the shoes and see the demo how it affects as well. Alright. So Raja, you hold the cameraman today. Maybe you can go that side.
Okay.
Easier.
Sorry.
Okay, thank you.
Okay.
Okay, now we have taken links just now and links. Okay. So now, first thing first, he has given us size 11. Why we ask the size shoe? Because we know somewhat what size we take, because there's always 8 sizes in male and female. Okay. So
Is it correct? Size 11?
10.
or doesn't matter. This one just for rough idea only, right? I'll take 12, 15.
10 UK, US 46 lah.
What does it say? What's that? 9 or 10.
Okay, so 10. I will take size. For demo purposes, I'll take some of size 11. Okay. Okay, now he size 11. Okay, first thing first you need to do is always on the median aspect, near the calculum there, mark the outermost point. Okay, let's say we now take Suraj's one. Okay, this is the outermost point. Just mark the outermost point. So for him, this is the outermost point. I already marked already. Okay, that's done. So next thing is you need to mark here the outermost point of the heel. Done. Okay. So for demo purposes, you are size 10. I'll just take size 10 to equalize. So this is left, this is right. So always there's a left and a right as well. R is right, left. Okay. So this is the left side. So I take the left L. Okay. This edge, right?
Right.
This is the right side.
Sorry. This is the right side. This edge. Okay. This edge sits here. Not here. This one. I'm talking about this.
Okay.
Yeah, right? So I put here on the line, I swing, it touches.
No.
Okay. So this is size 10. Okay. For demo purposes, I will show size 11. So not all patients coincide with the size. So different patient, different size. Okay. Now it's right.
Interesting.
Okay. Here, touch, swing.
Big.
Okay.
Big.
Over already. Alright. So we want size 10. Again, another way to test whether which size fits better for his feet. Okay, now you see now. Okay, this is 10. Right 10. Right 11. Okay. Now put your right leg on top. Okay, right 11. So this is 10, this is 11 right leg, right? So you can come here, place it on his knees. See this fitting shapely okay now. Alright? So this is 10, huh? So now I'm doing 10, 9, 11. So this is going too much as well. It doesn't matter. Depends on how comfortable they are. So I think he will better do better with 10. Alright? So 10, 11, it doesn't matter actually much. Okay? Because both also is fitting. There's another way you see. That's how you see how the broadness will help for a female patient who are broad. You can test and see. If it is sorry used and the leg is still inside and then it's too much, then you can use back the narrow one. Okay, now?
Narrow abroad from the footprint itself, you can roughly know.
No, don't do that. Female always use the M size.
Okay.
And
No,
then-
I mean, like you said, I mean, sometimes female needs a broader one.
Yeah, you sometimes
From
you
the
see,
footprint.
yeah, sometimes you see exorbitantly broad female, then you. So far, I've only given one patient. Out of so many, only one patient I've given the broad one. Okay, now size 10 ready. Okay, now W10 left, W10 right. Okay,
Male.
male, yes. Okay, now Ling, I want you to wear your shoes first.
Narrow, okay.
Narrow and wide.
Okay. Who? Okay. Chong, you have a cap on your coat, right? Okay. I want you to take a picture. Okay, now stand up. Now, when you scan this wall, okay, stand, come here. Stand in the same, this box up. Chong, you go there, put your hand straight down. Stand as how you normally stand. No need to stand at the wall. Just where you stand, how you normally stand. Okay. Now you take a picture.
From head to toe.
Head to toe, yeah, the whole length. Okay. Now sideways.
Wow, just like the mug shot.
Okay, back. Back to the back. Stand back. Stand how you normally stand.
Head up.
Okay, done?
Okay, wait. Sorry.
Okay, no.
One more check.
No,
Okay, sorry. Okay.
Okay, now. I'll take out the shoes. I want you to wear this. Maybe use his phone to take the post wearing so they compare.
Pre and post.
Yep.
Oh, okay.
You need to stand in the same position as like this now.
Okay.
Okay, now just loosen up a bit. Just loosen up a bit so that because this once you put in, once it still settles down, you need to feel a bit tight so that you need to loosen up a bit. Okay, so it's written L for left leg, yes for right, left for right. Yes, that's right. Okay, right shoes are okay. So you need to put it in and push it all the way back. It means this comes to your heel, not the front. Push it all the way back. Okay. Similar. This one is similar. Comes inside. Push it all the way back. Now wear your shoe back. Sit down. You want to sit in the chair? You want to sit in there or what?
That's okay.
That's it. Better. Don't go back and scold your mother. Huh? These are the same thing you can do for your patients. Take a picture before wearing and after wearing. Okay? Those who are actually, anybody of you are slouching too much here today? Any slouching effect? That you can see a lot of difference. Those who are slouching, you can see immediately they are still up.
Do I look scotchy?
You were all metal piece problems. So next we will try for money. So those who obviously slouching, I can see them
Up back.
immediately straighten up.
Oh, okay. So scoliosis changes all can see some changes lah.
Scoliosis, scoliosis.
They're sideways, but you know some of them will be stooping forward. You know.
Yes, the people you can see the
You can see that.
immediate. The moment you wear, whether you like it or not,
It
because
will-
it is correct the arch and the length already. You like it or
so it'll
not,
come like that.
you will come like that already.
Okay.
So you are now ex-policeman's father, like you still like father already. Then.
Kyphosis.
Yeah. Little bit can. The severe one, then you can't do much. But bone already fixed. Yes. Little bit of that can, and then you go for physio. Aggressive physio actually can actually. Okay, now you're already taller a bit, correct? Okay, now those who are seeing from just now, do you see any difference or not? The way he's standing,
Yes, straight.
alright? Do you realize? Do you realize he's standing very straight now? Okay, next, sideways. Can you see the straightness that he's having?
Yeah.
That's what the obvious thing you do, whether you like it or not, you can see that. Okay, next, back. Alright? You see the shoulder now straight. Just now was tilted. Okay, now you can to have thing. Chong, do you realize? You've been taking the picture, you're seeing your son so wrong. So you should know, you should be realizing more. But those who eye level you saw, right? Alright? What difference correcting all the three arches and correcting the limb length difference does to your body?
Yeah.
It brings everything back into position.
Back shot.
The
very
back shot,
obvious
yeah.
back shot.
Okay, now, okay, we put it here. Okay, put it here, put it here. This is pre, right?
It's free.
This is pre, this is post. Okay, you see, the some amount of slanting is there.
Yeah.
Some amount of slanting is there. Another thing, another place you must see, I show you is this leg space. Can you see the shape?
Yeah.
Now it's even. Can you see?
Space.
Because why? His hip was internally rotated. Now it is corrected back to normal position. You understand? So it not only correcting your spine, it corrects your hip as well. So he was internally rotated just now. The moment he rests, it back to normal. Alright? So now is side please, side me. Okay. You see, you can see the shape. You can see how straight it is. Can you see the chest? Can you see the chest? Whether you like it or not, is straightened up already.
Yeah. Yeah.
That's how.
So much of difference.
That's how when you correct your arch is perfect. This is how you're supposed to stand. This is how your posture is supposed to be. That's why we're doing it. We're not doing anything extra. We're just correcting the arches, all the three arches, and we correct the difference. Alright? Okay, now go back to the back shot.
The other one. Yep.
Okay. So now slanting is there. Now it's very straight.
Straight.
Can you see?
Yeah.
Alright? Can you see? Again, look at the space here. Leg space. Look at the leg space. Because you was internally rotated, the hip was internally rotated. Now goes back to the normal position. So when you walk, do you feel like a golf ball under your feet?
Not golf ball, but still.
Pardon?
Still small, but not a golf ball.
Like a small ball like that, pressing on your feet. Correct? That is the one that is going to massage all the tightening and the loosening, everything. As you walk and walk and walk, you won't even feel the thing there. Just the beginning, you feel something is there. After you walk, rest assured, I don't like to go out of the house without the intro. That's how phobia I am really now. I feel that more I put there, everything stabilizes. So you saw on your eyes how it helps. These are the same thing you can demo to your patient as well. The pre and post. And the obvious thing you can see on your eyes as well. The moment you do, people settle up. Alright? Any doubts on the sizing and demonstration to the patient? So these are the things you can do to show the patient the difference. Because it is not like you come after 2 weeks, you see the changes. It is on the spot changes that happens. Where you can see, patient can see. I have one patient, straighten up, I say, how you feel? Oh doc, I can breathe better now. Lungs are opening up. I never thought about it. Till the patient tells me, doc, I can breathe better. I was just now, I was very uncomfortable breathing. Now I feel I can breathe better. I never expected that comment from him. So there are other things that we don't even know that happens in the body. Only when that patient tells me, "Oh, yeah, correct.
Posture straight.
Posture straight, the lungs are
Lung
opening
open
up,
up.
and you are breathing better." Alright? So you want to, shall we do for demo for money? Alright. Okay, money.
Itu machine. Era boleh fly pun boleh. Pakai balik.
The money is again to a size 8.5. Here has to be 5, 10 and 6.
It's a very nicely taken.
Good. Outermost roughly here lah. Okay, take here. This page here. Touch. Okay. There you need the big small one. Okay. So for male, it starts from size 8, right, goes up to size 15.
Oh, I'm thinking, oh, I'm going to take
Female
size for my
starts
son.
from size 6
Oh, because it's not difficult.
until
Thinking how to make to get the print lah. Once I get the print, because the feet is like this.
Oh,
Dr. Ben, another thing,
Richard lah kalau.
see, as I told you, some patient I told you like my son, the food is inverted a bit, no.
okay.
So, one paper, one food lah.
So you know, you can do one paper on, doesn't matter. That will help you.
Yeah.
How old is he now?
It's 12. 13 lah, this year going to be 13
The only
already.
problem with kids is
I have to buy more lah. I
every
mean,
year you need to change.
size. Yeah.
That's the only problem. And then see, the selling price, this one, we have to match with the Australian price. They don't allow us to sell lesser. So Australia is sold as 440 AUD. So over here, we supply to the clinics for 1,000 ringgit. Clinic sell 1,004 or 1,005. So there's a huge margin for the clinic lah. Alright. So your son, then you need to spend $1,000 every year.
But doesn't matter, I mean, if it really improves
But it will help. It will help.
Yeah.
It will help. So this is size 9, huh? I'm taking R, W9. Okay. Here, cannot. Just now was, no, just now was 10 is it, or 11?
11.
Oh, it's not 11, so I need to try 10. This is 9.
10 is wearing.
Oh, that's why I was.
And he's wearing.
Oh, okay. So are you taking it out or?
He's wearing.
He's swapping
Okay.
the card.
His,
Oh, okay.
Doctor, you want to use it?
No, I take another one.
This one has more than.
Should have.
W10. Lelaki and perempuan.
Terbalik.
Tahu lah.
Hah? W lelaki.
W lelaki, okay. He's size 10. You're size 10 as well. Okay, now, when you wear your shoes.
Macam ni. W should be woman.
Pardon?
W lelaki.
W lelaki, N is perempuan.
White and then
Wide and narrow.
Ah. I thought woman and man.
No, this is white and narrow.
white and then
Somebody take picture of Dr. Mani with the shoes.
Nanti ada rekod visitor.
Kasut baru ya.
You want to use your phone?
Few months, but I rotate a lot of shoes there. So.
Handphone nak ambil gambar.
Oh yeah. Okay.
Position. Then stand how normally
Normal
you stand.
stand.
Yeah. Your rest of your observe is position.
Right. Okay. Okay.
Macam workshop pula.
Okay. Dah.
Okay. So now, there it
Jadi
is.
nak compare dengan
Boleh tak? Boleh ambil same phone and then
Same.
collect kan?
Tak tahu macam nak connect.
And then use my phone. This one, right leg. This is left. You need to put all the way in the right side. And then push behind. Okay. Yes. In and push behind.
Kasi mahal kasi.
Japanese brand.
Yes.
Japanese
Japanese high-end.
I think that's more than I cannot wear because my feet are white.
Is it in
So
yellow?
kita kena pakai yang white.
So those who white foot, I go for New Balance. They got the 2E, 2D. You
New
buy the-
Balance?
Yes.
Oh.
They have the code for 2E, 2D so that the whiteness increases.
New Balance is what?
It's a sport shoe.
Sport shoe.
Like Adidas. Like
So only so far I've seen only New Balance.
They put
like this.
NB.
NBR.
New Balance.
It's
It's a brand.
Maybe you can see
from that
NB.
one.
Ada semua
Semua
ada.
ada.
Semua ada.
The
Semua ada.
normal short
So those who are broad feet, I suggest to use that because they come with the broad shoes.
What is D? What is E, doctor?
Whiteness.
Whiteness.
The E is more white, D is lesser white.
Oh, D and then E.
Yeah.
Okay.
So it goes by the whiteness.
I think you have to go to New Balance store lah.
Yes,
Specific
correct.
store lah. Because
Doctor got
sometimes
New Balance.
mixed one they
Pardon?
won't
You
have.
got the
all.
Yeah.
quite comfortable. lah.
Yes.
Okay.
Because mine is broad. My feet is broad. That foot some more.
Alright.
So I have to go for the 2E.
We are picture.
Maybe they-
Okay. Then pusing.
Straighter.
Okay.
Macam lurus
Lurus.
Pusing.
Lurus dan tegak.
Wow.
Can you
Yeah.
can you appreciate the difference?
Yeah.
So, Mani, do you feel you are standing straight?
Yeah.
Diam yang
First,
belakang.
belakang.
Which one is pre and this is pre, right?
Pre-post.
This is post.
Pre.
Post.
See, one thing the shoulder. You look at the gap between the hand. Can you see? It's almost equal now. Alright. Look at the spacing. This is
Yeah.
spacing. Wow, perfect. Can you see that? You need to look at all those spacing. That's why with the posture that it stands. Alright. Next. Okay. You see, you're straightening up. Whether you like it or not, you straighten up. Can you see the difference? Alright. In visually you all saw as well, right?
Yes.
How it became the cup. Okay, now you see this. You see this space, See this space. Again, you were internally rotated. You open up, your hip open up. So it corrects your posture whether you like it or not. Because the arch is meant for all that. Once your arch is corrected and your limb length is corrected, everything straightens up. It's just that first 2 weeks, you might have the muscles are getting adjusted. Don't bother. Go ahead walking with it. Do you feel like a ball sensation?
Yeah,
Correct?
yeah.
Under the feet?
Yes.
As you keep on walking, the thing will disappear.
Especially the arch area.
Yes. So all that is correcting. Alright? So I'll demo to you one. Okay, now you just walk here. Just walk up and forth. Which leg is more pain? More of the ball fall paining, right or left leg?
Same.
Both, but which one is more?
Right? It's a bit more.
Right, it's a bit more. Okay, now you sit down here. Take out only your right shoe. Put the leg here, up here. Okay, now this is where the pain is, correct? The ball pain. So what I'm doing now, what the insole is going to do, I'm just doing it for you for a few seconds. I'm just loosening it up. Okay, this is what the function of the orthopedics is going to do. You loosen up the muscles so that all your the whole arch becomes normal. Alright? I'm just doing it just to loosening it up.
Yeah, it's exactly the same place I have.
Yes, that's right. I'm just loosening it up. Okay, now perfect.
So we need to change the shoe size also.
Don't you just loosen up because once the arch settles in, you will be back to normal size. The tightness won't be there.
Cool.
Just the
Small
beginning
movement.
you will feel a big tightness. Okay, now you walk. Now which leg you feel more?
This one reduce a bit.
It is just a few seconds of loosening. you already saw the reduction of
Reduction,
the
right.
feeling already. So that's what will happen. As you keep on walking, it loosens up.
Reduces the pressure.
Yes. Now you feel
Just
more
now
on the
it's
left.
like tight.
Yes.
Just now like relax in few places.
Because I didn't do anything magic. I just did a massage to relax the muscles. See?
So the golf massage is the pressure giving there to relax
Relaxing.
like
Yes. So once that is relaxed, you won't even feel it there. That's how it is.
Or the golf ball sensation is because of the tautness
Yes.
of the muscle down. So
Right.
once it's you massage, it relaxes.
Yes. That's how it works. And then it molds your whole leg to have a correct transverse, median and lateral.
Now after using this one, just now I had a pressure over my toes. Now reduce.
Oh.
Yeah.
Instant.
Instead, because you whether like it or not, it's correcting in your
Usually when I put the thing, I can feel the pressure here, but now no pressure.
So that's how it actually makes wonders. I was shocked,
Try
surprised as well when I first bought it,
Minimum.
but it actually is very good. A very good product to settle all the musculoskeletal issues that your patients are having.
Then you can correct your golf also.
Yes, because you have good posture one,
Yeah.
so you can swing better.
Haha, thank you for the idea. Not selling point.
Alright, any questions?
Good. Now go to the nearest golf course lah.
So we have boards here as well. If you want to purchase one, you can take it today. Then I'll ask our admin to communicate with you for the payment later. It's not a problem. The boards we sell at 750 ringgit. Alright, the one-time investment board belongs to you. Comes with the roller, ink you need to buy yourself because again we have this issue of providing ink and it's spilling and everything, so we stop providing the ink. Right? And then the insole we sell to the clinics, to the doctors at 1,000 ringgit, and you can sell to 1,004, but nothing less than 1,004 because that is controlled by the Australian supplier. They don't want to sell cheaper in one country and another country, so they want to standardize the price. You go to Australia, it's 440 flat, that's it.
Insoles can buy today, doctor?
Yes, you can buy.
Okay. I
Yeah.
think that you can buy for
Now, if your son, then he can take it. He can take that.
So you just wear that.
See if it's uncomfortable. See, sometimes some people will feel big uncomfortable feelings. You can pace your. You can go to a slow path, medium, or fast path. Slow path you use 5 minutes in the morning, 5 minutes in the evening. Next day 10 minutes. You can do that as well. But most of them can bear the uncomfortableness. You just continue wearing. If you cannot bear, then you just follow the path. Alright? Okay, can.
Tapi mine
This
tu
one.
kecil. I bawa tengok. Cuba I tengok.
The golf ball sensation is actually the muscle tightness.
Yes, correct.
No, what I mean is the sensation is because of the muscle tightness.
Yes, correct.
Itulah. Tak ada geran. Tak ada geran.
So you saw the difference like this? But that's for a while only.
1,005.
No, minimum 1,004. Siva is selling 1,005. That's why it's recommending video. But we want to convert 440 AUD into Malaysian ringgit. They don't like you to sell lesser.
Cheaper.
Lesser than that.
Lesser than that, we are in trouble.
Okay.
More than that, they don't bother because they don't want people to come and tell you, I went to Malaysia, I bought it for
Cheaper.
cheaper. That's the thing.
Okay, 1,005 is the price lah then.
Okay.
Should I put here back, huh?
But this footprint also good business.
Yeah.
So they see that, then they trust. I see. Okay, this is very good.
So normally once you have the fashion sizing done,
Okay lah, but
it's
still
better to write there so you know next time to refer. Right? Now your phone. Later you will. I'll send it to you. Yeah, I'll send it to you. I just send on high.
But later we share it with us this week.
Yes, I'll
Because this doesn't have strings.
No, it doesn't matter because this is still flexible. You can
Yes,
just
okay.
later then you can have a comfortable shoe to wear. Just to demo purposes you can use that.
I don't have the.
You are size 5, huh?
Maybe 6, probably 6. Very small. Small feet. So I have to My mom, everything is
Yeah, very small.
Now, this is the right. This
So
one.
like the kids.
kan tu sama.
No.
Oh,
This is too small for
see?
you.
Too small. Too
This is it. It doesn't coincide with your shoe size.
Then maybe
Your
7.
kids maybe 7.
Ini 6 US.
So for children, they need to review every few years.
Every year.
Every year they grow.
Every year they grow. So
Up
there's.
to 18.
18 then hopefully they
Okay,
don't.
you are 7. Okay, now take a one
Okay.
poche first.
Right, okay, pass it. This is okay. Yeah. Side. Okay, belakang. Guna sige.
Yeah.
Yeah, okay.
Okay. Now you see.
This one also lopsided.
They're going to go to the walls. Okay, well.
Okay.
Right? That should put inside. Or do you have?
So sample we got 2 or 3.
What?
Sample got 2 or 3.
Ah, okay.
Oh, dia jadi ketat because
Because-
mama kena study that because mana boleh tak ada ini
Oh, this is the.
This style here.
Style dia.
Generally.
Tapi pasal at home I ada yang
You said this for demo purposes, okay, like this for a while.
It's like that simple.
Should always wear socks on over the.
Yes, always wear socks because why? The material is such. If you sweat, then you get stuck.
Ah.
So you already had one. You then start having blisters. Now they always wear socks.
Okay.
And then with socks, the material will last longer as well because the sweat interaction with the thing, then you will have some issues. Now temperature is very humid.
Now this one can cause allergy to some people. They have allergy to what?
Correct.
Like that, the silicone one.
Coba ambil gambar dulu.
Ambil gambar dulu mah.
Ah.
Jangan ada.
Ah.
Okay. Side.
Do you see the difference? Is still up.
Yes. Belakang mah. This one also good. So obvious memang belakang mah. Dah mami.
Okay.
okay, let's see.
This one pun dah ini.
No on this side.
The shoulder.
Because for one kaki very
Kaki radio is
right. Then the side is.
sideways.
You feel not? You tegak sekarang. You rasa tak? You rasa tak? You tegak. You dah tinggi sikit.
Oh, rasa tinggi
Okay.
lah.
Betul kan? You dah tinggi sikit.
Oh yeah, yeah. Taller.
Taller.
Taller should.
Standard ya.
That's another selling point.
Yeah. Can be taller.
Mana-mana tak ada ini RM5.
Oh, sini
Yang
kan.
ini RM5.
Because your tudung you tak nampak sangat.
Nak cakap tadi apa dia?
If not, you can see the.
Masih di sini lah.
Yes. But do you feel not? Do you feel that you are straightening up? Do you feel that?
Even the kaki.
Ada lah.
Yes.
Even the kaki.
Yes.
Masa kiri.
Yes. You can see the shape. So the internal rotation now back normal. That's how it is.
Yes.
Dah.
Okay. So ini ambil tu balik ya.
Okay, boleh juga.
Banyak makan je terus.
Boleh boleh. Nanti kan, bill nanti.
Nanti bill nanti ya.
Oh, banyak
So this one is your.
Where is
Everything also the 10. Yeah, yours and 10. Yeah.
Try and see.
Just try.
Yeah.
Nanti my
You
cousin
try
got
first.
something.
You try first. After that.
Try non tak boleh.
Try.
Dia kena. Ya, ada shoes.
Oh, aku tak tahu dulu. Because my shoes already
Your shoes already there.
my shoes already have orthotics in it.
Okay, what
Because,
color is you using?
I'll bring it to you.
Okay.
Because of my friend.
She had that problem so she had to fix it at the leg.
Okay, custom made one.
Custom made.
Custom made doesn't actually do a lot of things.
Yeah.
Yeah, I've seen that. Unless you have drastic difference between
Kan dah ikut sana. Ni ke bawah?
Oh, she's trying.
No, she's just waiting to show the shoes.
This is the right one.
See, you see here, it's only here. Can you see it? It's only here. There's nothing here. This is it. Can you see? It's only the left middle. They are taking care.
Yes.
They're not taking care of the Better
Better.
the chances.
Because my one is obviously.
Alright. Okay, now you take one without this.
One bit.
No.
Huh?
No, no,
Okay,
no,
okay.
no, no, no,
Oh,
no,
no need.
no, no.
Oh, this one.
Okay.
It's okay. It's okay. Take the picture. Take the picture with that.
Okay.
While I do your
Tepi sayang, tepi. Mama ni nak kat kampung.
Mama beli tu.
Yes, tapi mama ada dah.
Sebab nanti mama beli.
Sorry.
Mine is probably 8 kot. Nampak? Okay.
Okay, next. Senang.
You all observe
next.
the posture, then you see the difference.
Dah.
Semua orang sengit.
Semua sikit. Semua dah sikit. Kan, sini kan macam tu.
Yes, I know. I am very obese.
The longer
I
you
think
wear,
you are
the
same with your
more
mother.
Seven.
comfortable.
No, 8.
8.
Maybe 8. Mine is slightly bigger than mine.
Tak.
Berapa tu?
8 kan? Seorang menunjuk
This one
kita
is-
satu besar, satu besar memang.
I think one is your wrongly given, I think.
Oh, wrongly given.
I think one is mother is wearing 1817.
Oh.
Ha? Juga ke?
I think so.
Masya Allah.
Let me check the size.
Check.
Okay, let me see. Okay, betul. Kita tengok.
Ni 7.
Okay, the other size. Sama tak?
7.
Okay, then okay, then okay.
Jangan dah use. Dah busuk.
7.
Okay, then okay.
Aduh, ini.
Cuma.
This is 6.
Macam
Tiny.
Okay, you see it?
8.
Yeah. 9, 8, 7.
Ada tahu kalau macam one have to be another size another.
No, no, no.
No.
That doesn't work that way.
Doesn't work that way.
Ni bukan satu saja.
Satu. Baik. Jadi 8. Mana satu?
It's one more big.
Macam lebih lah.
Tak tahu.
7.
Ada tikus.
This one is 6. Jatuh.
It's just now the center.
Sini tiada.
Jumpa.
Oh, that one is 10.
And it was male kan?
Yeah. So most confident is okay. Okay, Raman. You demo purposes, you take out your 7, give it to her, it's use first.
Oh.
You'll be
Muat ke? Boleh?
Cuba tengok boleh tak sana. Right. Ni right dia.
they normally put the 8 and 7 together. That's why this one is 1, 7 and 1
Somebody bought it.
No, I think we do the demo wrong size.
We shall try. And this one I can.
This is 7. You also 7, not 8.
7. Yes.
Tadi dah ambil gambar kan?
Dah. Tadi. Dah ready dah.
Yeah, see the difference? How it's standing now
Yeah.
compared to just now?
Yes, next.
Tegak sikit.
Tegak.
Next. Nak, jom tengok.
So you feel that you are standing straight as well?
I don't know about that, but
Yeah.
I feel the combo.
On both sides, is it?
Yes.
Because you're flat.
I'm very flat.
Yeah, yes.
Very flat.
Oh, ada.
Okay, which one is pre, which one is post?
Free.
Okay, now you see shoulder is straighter, right? And then we look at the space here. It's better now. The inter rotation. Alright, can you see that? Next one. Okay. Can you see the straightness of the spine now? Look at this.
Yes.
You are already you're slouching just now. Now you are straight up straight. So the slouch is no more already. Whether you like it or not, you won't slouch. Okay? Next. You see
Yes.
straight. Can you see the straightness of the shoulders?
Yes.
Alright? And then we look at the space here, equal and nice. Look at this. So again the all the internal rotation, everything is fine. This one goes to the same. Yes.
This
To
one,
more
ours
skin.
goes-
Yes.
Yeah.
So whether you like it or not, the body corrects by itself. Once the arch is perfect. That's the whole concept.
Okay.
Okay.
Alright? You're also a size 7. Tim,
7.
You and Ade can share.
You know, she's going back to Adelaide tonight. I send you off. So, can you have...
No, you can give it to first, then I can send it to your clinic.
Okay, alright?
Yeah.
Yeah.
We have stock because we just bought one size of each color only, so just for demo purposes.
Okay.
We have stock, I can send it to your clinic, so she can take it first.
Okay, terus. And then remember it's size 7, yeah?
Try first. Try.
Okay.
Size 7, eh?
Yes, I already wrote already. I will send it to you.
Okay.
Only then.
Kan senang.
Just yeah, then you can always wear any shoes.
Yeah.
Size 10.
Any shoes?
No, you need to do the sizing first. He doesn't follow the money.
Do you have the extra... This one?
Yes, I give it to her.
Oh yeah, it's with me. It's okay, it's okay. You send one phone to me.
I'll send it to you. I'll send it to you.
No.
Now, again simple. You mark the outer most. That's all you need to do. Do this one.
Huh? 13.
So say, it doesn't correspond to
But the size 3 can go inside the size 11 shoe.
Can. Because why? It doesn't work that way.
It just goes back.
Yes. Because that one is full length. This is 3/4. So it doesn't matter. Right? So this is for the... So take picture first. Okay. Take picture first. Sure. This one.
You sure? Betul? Tengok betul? Ya, tadi banding sama mana? Ya.
Okay, just take.
Breakfast time.
Stand how normally you stand here.
Okay.
Yeah.
Yeah, that.
Okay. Alhamdulillah. Okay, good. Bos, beri sales aku lagi lah, bos.
Hello. Perfect.
Okay, dah. Satu orang satu lah.
Beside it, put your jack all the way back.
Feel that.
Just to loosen up your base a bit. Sabina, you are saying it moves in front, so you push the hand. Yeah.
Kita bagi dulu.
Semua mungkin dah.
No, that one can explain. Now I'm wearing like yours. Now I'm already expand already, so I don't have to. I just keep in. My shoes are there. I mean, my steps.
Easier lah.
Yes, there.
What size are you wearing?
Mine is 12. Mine is W12.
So my son is just turned 18, so I think it should be okay.
18 is okay. 18 is okay.
Yes, I do.
Below 18, because the foot is still growing. So boys and girls. Boys and girls. So always advise. Up to
Once a
18.
year lah.
Once a year. Sometimes
Yeah,
it doesn't
okay,
change.
okay.
Doesn't change size, then you should luck lah. No need to buy. You change size, then you change.
Yeah, you look
Change it,
really-
no. Don't change it, no. No, stand in the same place where you stood just now.
Wow, so
Yes.
straight, you know.
Yes. Can you see the difference?
Yeah.
Yeah.
Because he was body was already
Your
phone. Okay.
It looks like really
Hey, Chief.
Okay. But I feel my front part of the close one is like floating.
Floating. Okay.
So now you see, what is it up already? Can you saw the difference, right?
Yeah, because floating because you know the pressure.
Oh,
Like
is it
mine
because
is
of
also
this?
floating. I told you.
Yes, yes. Now he's taking the pressure away from the toe.
That, yeah.
Maybe not used to it.
Not yet. As once it molds, it comes to position again.
Shoulder.
This is pre, right?
This was.
This is post.
This pre.
Okay, let's go back to. Sorry. Go back. You see, can you? This is post, is it? This is post, right?
Yeah.
Can you see the thickness?
The shoulder,
Can you see
especially shoulder
bulging?
of this.
Now you're getting the spine shape.
The
Right?
chest also very.
Yes. Means you already take up already.
The stomach was bigger.
Yes. Last time you're hiding your stomach by slouching. I have to go up already. Alright?
How can exercise?
Can you see? It's all stunting already. Now almost straight. Alright? Look at the space here.
Slow.
The internal rotation is happening. Can you see? It's coming. The line is going up some more. This one is close. Can you see no? The difference? The line is coming, opening up more. This is stopping it here. Sorry. You understand trying to see?
Yeah.
So that's all because of your hip internal rotation now coming back to
I do feel my lower back like straightened up a bit.
Yes.
I can feel it.
Correct.
Okay, then front.
Actually, you cannot slouch.
front. Okay. Again, you see the shape? It's now more balanced compared to this. Can you see that? Again, because of the internal rotation. And your shoulders are straight compared to standing on side. Yes. So, as you walk, the feeling of the wall thing will go off. You still feel, right? So, as you walk and walk and walk, you'll be okay. It's just that if you feel too much of discomfort, then go for the medium space or slow pace.
The bunyan exercise, how is it?
Okay, bunny exercise very simple. Now your toe is there. Your great toe, now you can see the bunny is
Bunny,
moving.
yeah.
Just imagine this is your great toe. Alright?
Huh? Like badminton, whatever.
Support it with one hand. Let's say you support it with your left. Make the toe is here already. Just 10 times like this, 10 times like this. Do whenever you are free.
Okay.
Slowly this thing will come straight.
Oh.
That's all you need to do. Because you already stopped it from getting worse. So now you need to break the calcium. All we did and then become straight. I have a photograph showing that the stages.
It's
But
getting better.
yeah,
After how long?
it depends how rajin you do and how big is the banyan. Yes. So slowly becomes straight.
Clockwise.
Clockwise, anti-clockwise. Because actually you what you're doing is just breaking it. You're just breaking the calcium. That's all. And then it becomes straight now.
You also level. You also 13 now. Bigger some more, eh?
No, 13. Go down. 13 pull-ups.
Pull up some more.
Plus some more. The thing is here. This. Right now, 13 now.
Okay, now 13. You try 114.
Try 14 and 6.
So you see the difference. 14, I think. They kept it for Suraj outside.
Oh,
Your engagement question.
It's oh, but thing is after this part, whole the front arc is feeling like rotting.
Yeah, because
Because you always use your toes a lot. So
then here,
suddenly,
because of this one.
It takes time, I think.
No, but I feel above this point, everything is like rotting.
So the pressure is no
Sometimes
more.
I think,
It's no more. already.
because you lift the pressure.
See, just say you want to try 14, huh?
Pulled up a bit.
Here, it's too big.
It's too big.
Oh,
Understand? So you for your calculation first, you usually can try and see. That's why we do the sizing. So what is 13?
Yeah.
okay, until it reaches one. Okay.
You know, take pictures first before putting.
Before and after.
Before and after.
Okay lah. Wear shoe first.
Where's the phone?
Phone blue battery.
When I take the
Okay, yeah, bro. Okay, bro, one shot ah.
I know tak dia punya soon ada.
Okay,
Pakai ubat.
3, 2, 1. Okay,
Itu
side.
sana. Kat sana pakai yang
3.
Dia pakai sender.
Betul-betul maksa tadi. Habis lah. Okay.
Back view.
Okay.
Now, inside G, right? That left, this is right. This is right.
You think both same?
Yeah.
13 now.
Yeah, both.
13.
12 or 13?
30.
Now everyone can walk the shopping mall around.
Can feel it.
Good. Now, stand again, picture.
Another phone. So, jump up me one.
Mind
Okay. Position.
Same position.
Okay, 1, 2, go. Okay,
Kenapa orang tu?
side.
Okay, senyum.
Okay, belakang.
Okay.
Okay, head up.
Stand straight.
Okay.
So, physically you all saw how he was standing before
Okay,
and how he's standing now.
pre and post.
Someone was slanting is there. You see the shoulder, alright? This is straight up, yes. You bring, you go back to the sides. Okay. Can you see?
This more straight ah.
Yeah, straight. This one, you got curve to there. This is already straight up. You are take up. Can you see the chest as well?
Which okay, straight the stomach because of
Right?
Oh yeah.
You see?
Banyak beza?
Can you see the difference? So, is whether you like it or not, it corrects the position. That's the whole concept. So once the position is correct, the musculoskeletal issues all will get corrected as well. That's the whole concept. Alright?
You know your right leg is
Any other
is
doubts?
big,
Ah. Yeah.
right leg.
Yeah, memang.
Because,
No, this one is size 10.
Even if
Yeah,
it goes
very
like
tight
this.
No, I don't think so. His feet will grow anymore.
Flying this one.
Yeah.
Maybe because you have to wear the
Usually what
shoes
shoes are
like what
not
when
big
you have to do like a lace and stuff.
Yeah.
So you can loosen up this one.
Should not
can't
be
be.
for-
Once I think once is already more to your feet, then you can
Unless-
wear this. I think beginning you can't
unless,
wear.
Because yours is
What you call
the
the shoe
shoe
size
height.
changes.
The height is fixed. So
Let's say
you
now
feel
it's
very
time,
tight.
suddenly, let's
you
wear
wear
one
this
side
and
bigger,
you
then we need to
Beginning lah.
reassess
I think once you already soften, then I
At
think
this
it's
moment is 10.
That's why you feel the
Alright,
tightness.
unless you change the shoe size, and then we need to reassess it.
So my other friend was he was wearing with
Because
loafers.
sometimes they grow up to
He
21
was
as well.
wearing loafers.
That's what
It
Ben
seems to
Ben
get taller every
suggests
6
beginning
Yeah,
use the
so sometimes
with
some
laces
instances
so
are there.
you can loosen
After
it up.
21, after 21, of course, no, it's very safe. It doesn't changes. But some will go up to 22. Let's say the shoe size change, then we have to change. Get a
No, because this one got no place.
resize and redo the print and everything. So we have boards in stock as well. Those who want to take the boards today, you can take it. We already have it. Yeah.
So,
I'll take from there.
Yeah.
so
I'll buy the
you
board.
take it board and then we will.
Okay, I'll buy the board.
Okay.
Lepas tu hutang kan?
Yeah. I will send you the your size as well.
Okay.
Yeah. Just write it down so that I don't forget.
Chong, you want a board? Do you have a board
Is
ready?
it
for you?
okay if I don't get the board?
It's up to you, it's up to you, up to you, it's up to you. It's up to you because those who want to do the footprint can then get the board.
I think I'll just send my patients to you
Okay,
for printing.
So I don't know. Ni lah 13 lah.
13.
I got this one.
The board you send together lah?
Yes, yes, correct.
Okay.
Pak dia ada buat kat sini
You want 13?
So I buy the board here.
I'll give you the band board now.
Oh, yeah,
I only send the your size.
Okay.
Your size I put it